Good morning, dear colleagues. It's my pleasure to see you here. We are lagging behind a little bit, and we are opening our Zoom conference, and we are going to discuss the effect of the COVID-19 pandemic, its effect on prevention and treatment of HIV, TB in the countries of the Baltic Sea and in the northwest of Russia. I would like to give the floor to the General Consul of Finland in St. Petersburg, to Mr. Olli Kuka-Järvi. Olli, you are welcome. Thank you, Dmitry. Good morning, esteemed participants of the seminar. The General Consulate of Finland in St. Petersburg is keeping organizing international seminars for a number of years, and the seminars are dealing with such problems as HIV, TB, virus hepatitis, STDs, socially significant diseases. This tradition is being continued this year, but the pandemic introduced corrections into our plans, especially it's affected the format of our work. At the end of summer, we planned to launch kind of hybrid format of a seminar. Wanted to invite experts from St. Petersburg, to invite them to the General Consulate, but then at the beginning of October, we had to take into consideration the aggravating epidemiological situation, and we decided to launch the seminar like today online. As usually, our seminars were welcomed very positively by the experts, and we can see that cooperation in the area of STDs actually is very topical. Besides, our seminars allowed to enhance the exchange of the information, to enhance to develop the connections between the experts in the region of the Baltic Sea countries in the northwest of Russia. This year, when the pandemic situation started, our contacts narrowed, and our ability, chance to travel narrowed, and we have to agree that such distance meetings, so to say, or online meetings and seminar are not maybe the best possible way of cooperation. As of today, the epidemic situation is tense, and we still do not have full scale of data regarding effectiveness of the vaccine, but there are promising results of the clinical trials. And during the last decade, we were witnessing the development of different highly dangerous virus infection, avian flu, Ebola outbreaks in Africa, for example, in the 2014, 2016. And for more than 10 years, 10 years maybe behind, we were talking about pandemic of swine virus. Today we're going to discuss HIV that was discovered in the 80s, in the last century, but still it's in the world, traveling the world. Hepatitis C actually hit more than 200 million people. Pandemia shows that the international cooperation is very important. When something similar is happening in the world, we must share information, we must share data, we must start open discussion of the problems. We are in need of cooperation between experts, between scientific institutions, between offices, agencies, and the countries. Only moving along this line, we could think about responding adequately to the critical problems. And today we are going to contribute to this task. I would like to wish you a fruitful seminar. Thank you very much, Ole, for your welcoming remarks. Our event is open. I'm Dmitry Titkov. I'm going to moderate this event today and tomorrow. I represent a Finnish Institute for Healthcare and Social Well-being. I'm project manager, and I'm involved in collaboration with Russia, especially with the northwestern part of Russia. And I must say that the major portion of the projects I'm involved in, they are dealing with the prevention and interaction and counteraction of infectious diseases. And I must say that for a number of years, this field, as a part of international cooperation, played a very important role. And we could speak about two-side, three-side cooperation, regional cooperation. That's why I'm very happy to see many familiar faces here today in my screen. But I'm happy as well to meet new participants, representatives of different organizations. And of course, I would like to thank the General Consulate of Finland for organization of seminars. And it's not the first year we are working together. And I would like to thank them for their kind hospitality, for their warm hospitality. And, speaking about our events, I must stress that the home-like atmosphere was typical of them, always, and they were not formal. And the committee for the healthcare of St. Petersburg always was very helpful as well. It's a good tradition. And for many years, we were happy to welcome here our colleagues from different regions of the northwest of Russia, of Scandinavian countries, Nordic countries. And speaking about the specificity of our seminars, I would like to say that they were like a cross-link between several vectors in the area of cooperation in the Barents Arctic regions, cooperation in the Baltic countries regions, and many good two-side projects were launched and implemented. The results can't be overestimated, and the consulate decided to organize this seminar as well. And this format allowed us to expand the auditorium, let's say, and these, I'm very happy that apart from our traditional participants, so to say, from the northwestern regions of Russia, from Scandinavian countries, from Finland, we have new faces, we have new participants from Germany, from Poland, from Baltic countries, and it's a special pleasure to see both state-supported institutions and agencies and NGOs here. It will allow, I hope, that it will provide us with more volumetric picture of the situation that we are facing. It's no surprise that we'll discuss new coronavirus here because the world is in situation of fear, tense, stupor, even uncertainty, and the medical community, healthcare system started experiencing additional pressure at times, and there was a situation when countries have to mobilize resources for counteracting the virus. and to think about new measures, about new approaches, and the virus restricted accessibility of medical care services. And in the middle of June, for example, some of our colleagues from Nordic countries, from Northwestern countries discussed with us. We discussed together first results of counteracting, and in April, in May, we discussed testing. We saw that what we call dispersation schedule, the care schedule, examinations, other services were hit by their accessibility was impaired. And but at the beginning of summer, there was the impression the situation started improving. And I remember that when restrictions were being retrieved, we started being more optimistic, and we started postponing our events, rescheduling them from summer to autumn, but then we realized the situation was more serious than we had expected. That's why I would like to invite you to pass over to the program of our seminar, and let's discuss our impressions, maybe the first results, maybe preliminary results that we could extract it from our experience. Maybe this would be helpful in our understanding of the situations the agencies, institutions, hospitals are facing, have found themselves. It's, so we could maybe see common problems, risks, and we are thinking about such threat as losing results that were achieved during a number of decades in our counteraction with HIV and TB. And so common things, different things, I'm sure it all will be very helpful and useful. And I would like to invite a representative of the WHO, European Bureau of WHO Infectious Diseases Department.
Good morning, dear participants of the meeting, dear colleagues. Let me just share my PowerPoint presentation. I hope that you see my slides. Okay, great. First of all, I want to thank organizers for inviting me to speak today, and wishing you all a very successful meeting. In my short presentation, I will be talking about the impact of the COVID-19 pandemic on TB and HIV services in WHO European region. And first of all, let's have a look at the snapshot of the progress before COVID. And before the world was hit by pandemic, WHO European region had been the only region being on track reaching the global target of 35% reduction in number of TB deaths, as well as 25% reduction in TB incidence rate compared to 2015. Which is a regional target, more ambitious than the global 20% decrease, which was almost met in 2019. As for the HIV testing and treatment cascade in 2019, 78% of people living with HIV were aware of their status in the region. 58% were on ART and 53% achieved viral load suppression. So for the region, main challenges were challenge was reaching the second 90, as well as there was a clear room for improvement of for testing the first 90. At the early stage of pandemic, there were a few modeling studies conducted to estimate the impact of COVID-19 on TB and HIV services and on the burden of these two diseases. And I will briefly go through the findings of these studies. Modeling done by WHO estimated that temporary decrease in TB case notification by 25% over a period of 3 months could lead to 13% increase in TB deaths, and 50% decrease over a period of 3 months may cause 26% increase in TB deaths. And this could mean from 3,600 to 7,200 additional deaths in WHO European region. And with these results, TB deaths could bring us to 2016-17 level, which is a step behind. Another modeling done by Stop TB Partnership also predicted increase in TB deaths as a direct consequence of COVID pandemic. As for HIV, estimation done by Imperial College, which is WHO Collaborating Center for Infectious Disease Modeling, concluded that greatest impact was expected on the interruption of ART, and in high burden settings, HIV-related deaths over 5 years may be increased by up to 10% due to this impact, compared to if there were no COVID pandemic. Also, there were and there still are few attempts to quantify the impact of COVID with looking at the disruption of HIV and TB services. And I would like to present you findings of those assessments and surveys. You will be able to access the detailed reports through the links that are provided on the slides, and I believe the slides will be shared to all participants later on. So let's start with the global TB survey. WHO did the qualitative assessment in April, May this year through the survey included in the global TB database, where member states were asked 3 main questions and also sub-questions. And 44 out of 53 member states in our region responded to this survey. Almost 60% reported some changes to TB treatment service delivery due to COVID, and negative changes included reduction of the inpatient and outpatient TB services. Approximately 30% of the countries reported this. But on the other hand, many countries introduced changes to find solutions to those challenges, including scaling up the remote service and support, introducing homes delivery services for TB drugs, as well as allowing take-home doses for drugs or involvement of household members for collecting TB drugs. And the good news is that 80% of the countries who reported introduced or scaled up at least 2 services out of this. Almost half of the reporting countries reallocated some TB resources to the COVID-19. 30% reported GeneXpert machines being reassigned for COVID-19 testing, which is the main diagnostic test for TB in many countries in our region. 85% reported NTP staff at the national or subnational level being reassigned to other duties, to COVID duties. And 50% reported TB budget being reallocated to the COVID response. And these are the results of the quantitative assessment done by our office, by regional office, and countries were asked to report monthly TB notifications for the first half of the year, as well as for 2019 to do a comparison analysis. And we were observing 5% average annual decrease in the region in case notification during last 5 years. So we would expect the same monthly and quarterly trend of decrease in 2020 if things were normal. But as you can see, for first 3 months, Q1, the decrease in 2020 compared to 2019 was in normal range, but starting from April, there was a sharp drop in TB case notifications, and on average, 35.5% decrease in TB case notification has been observed in Q2 of 2020 compared to the same period of 2019, which is 30% excessive decrease compared to the last year. This slide shows the comparison of quarterly enrollments to MDR-TB treatment in 2020 versus 2019. And we were observing no decrease in annual enrollments to MDR-TB treatment during the previous years. And on average for the region, 45,000 MDR patients were enrolled to treatment annually. And the first quarter of 2020 showed the same tendency, the same trend. Even 1% more patients were enrolled to MDR-TB treatment compared to the same quarter of 2019. But again, we saw a sharp decrease, 33.5% in Q2, which is higher absolute decrease than for the case notification. There was a global survey conducted between April and June, collected countries' real-time information on ARV stocks, and few countries from our region reported stocks available for 3 months or less, and 13% of countries reported risk of ARV stockouts. From other services, HIV testing was reported as being disrupted the most. But multi-month dispensing was largely adopted by the countries, and this was mainly for 3 months. UNAIDS, with support from WHO and UNICEF, collects data on testing and treatment on key populations and prevention services from countries through an online platform, which is an ongoing monthly data collection. It's still active. And this data collection activity aims to identify disruptions of routine HIV services caused by COVID, and countries are encouraged to share their regular program data from their health information systems or aggregated data from electronic medical records. And this slide shows the results as of mid-September using data submitted for January through June, and mainly Eastern European and Central Asian countries are reporting to this platform. And as you can see, country number 2 and country number 3, as well as country number 4, reported substantial decrease in testing starting April 2020, with overall decrease in Q2 compared to Q1 of this year. These are the trends in ART initiation for 5 countries of Eastern Europe and Central Asia, with all reporting declines in the numbers of people initiating ART between January and June 2020. Another survey that has been conducted by Eurotest, and our regional office was collaborating with Eurotest on this data collection. It was aiming at assessing the impact of COVID on testing for HIV, viral hepatitis, and sexually transmitted infections in the WHO European region. The question comprised quantitative impact on testing volume, and those questions were asked to a wide range of actors involved in the provision of testing services in the region. And as you can see on the slide, across infections, almost all respondents reported testing decreases from March to May 2020, as compared with the same period of 2019, including 64% who reported severe disruptions to testing provision, more than 50% decline in testing volume. Between June and August 2020, 58% still reported testing volume decreases. However, the degree of disruption was less severe during this period. And this time 20% reported more than 50% declines in testing. And 14% even reported increases in testing volume during the second half. I also want to draw your attention to the impact of COVID on Hep C elimination, which was high on the agenda of the countries of our region before COVID. And global survey led by World Hepatitis Alliance revealed substantial issues with the access to Hep C testing and treatment. And based on the modeling, assuming that those disruptions will last for 1 year, this may result in almost 16,000 excess incident HCV cases, almost 9,000 excess hepatocellular carcinoma cases, and 13,800 excess liver deaths from 2020 to 2030 in our region. In response to all of this, WHO issued a guidance on maintaining essential health services, which recommends practical actions to reorganize and safely maintain access to essential services during country lockdowns. And these are mainly alternative arrangements for treatment delivery and introduction and scale up of the use of digital health technologies during pandemic in both in HIV and in TB response. This guide also describes considerations about restart and catch-up services after ease of the lockdowns in the countries and after this pandemic is gone. So it provides a very practical guidance to the member states, to the countries of our region. There were a few initiatives as well led by our office, by Regional Office for Europe. And we are in general in close contact with the national HIV and TB programs, and we provide all necessary support to the countries. We set up the virtual library of good practices, and currently we have a call for submission of practices on response to TB, HIV, and viral hepatitis during the COVID-19 pandemic. And I've included the link to this library, so all are encouraged to report these good practices to us. Also, our office developed a quick guide to video-supported treatment of tuberculosis, of TB, and this guide is available in both in English and Russian, and provides answers to two main questions: what are digital health solutions, and how this can be of use to national TB programs. And the guide describes existing mobile application solutions used in the Eastern Europe and Central Asia, and provides guidance on how to replicate and adopt those platforms in other countries. I think this was my last slide. I want to thank all my colleagues who contributed to this work, and thank you for your attention.
Thank you very much, Georgi. And I would like to move on to the next bullet point on our agenda. And before that, I would like to say that a couple of weeks ago, I occasionally, well, not 100% occasionally, but via some newsletter, I found a report which was devoted to the research results of COVID spread among HIV positive people and the influence of pandemics over the medical service of HIV positives. So at this very moment, we were about to prepare this very event, and I immediately started thinking about how important this very research for our event and our discussion, and we of course need to somehow cover it within our discussion, and we need to invite these people to be speakers during our session. The geography or the coverage of that particular research is not about the northwest of Russia and Nordic countries, it's much wider, it's all Russia. But I suppose that the survey and its results and the conclusions made as a result of interpretation, I would say they can be applicable to our region, not only to the northwest of Russia, but also they go beyond the context of Russia. And I would like to say that I am very happy to say that Alexei Mikhailov from the coalition Ready to Treat is happy to speak about his research and also the results, and also to speak about ARV drugs and their availability to those people who live with HIV during the pandemics. This is a topical issue not only for Russia, but for many countries of the world. So it's my great pleasure to pass the microphone, to pass the screen, I should say, to Alexei. You're welcome. I would like to welcome all of you. Can you see my slides? Yes, we can. So first of all, I would like to introduce myself. My name is Alexei Mikhailov, and I come from the coalition of Ready to Treat, so it's ITPC Russia. And generally speaking, we are into research, and also we confirm that there is certain availability of drugs to the general population. We decided to conduct such trial, and especially about ARV medication, because this must be something that is available to the HIV positive people. So we decided to conduct this particular trial among the HIV positives and beyond that. So we talked about, within this study, we talked about prevention as well. So as a matter of fact, this is a list of co-authors. And you can see here that there is a summary of this study. This is a publication that was made in 2020 in Moscow. So generally speaking, it was supported by the Russian surveillance agency from different regions of Russia. You can see the geography of this particular study, and approximately 80% or over 80% of population of Russia live in these regions. This is a big figure, which is really indicative of the situation in the whole of the country. Also, there are different regions from the northwest of Russia to the south or the east of Russia. And you can see that St. Petersburg is among, or the region of St. Petersburg is among them. So this is the sampling characteristics. Approximately respondents were 590 people, and responders, or at least the report to this, are 262. And responders who were not tested for HIV are 79. If you look at the age groups, they are great number of different words. And over here, you can see the influence of COVID-19 pandemics over the medical service. That's 75 approximately %. That tells us about the fact that the social network has quite active people who are long on therapy, and they are quite active patients, and that is why you can see such figures. Now, you can see the most important aspect.
$50,000%, you see, they do not have anything. And there are many people who do not know about their status. They know nothing about even the system that could be helpful for them. We were surprised by the results, but the fact is the fact. So the survey was very useful. Speaking about RT, we have our own view here. That in Russian, experts responded very effectively regarding distribution of the RTV, RT. Many of our respondents said that they had no problems. For some of them, there were difficulties connected with the transportation services. Many of them were afraid to get out of the apartments because of COVID. So we have the whole spectrum of different approaches we surveyed among our patients. Again, regarding their responses, we asked them about their experience, whether new approaches were regarding the delivery of RTV, RT were introduced and could they continue without interruptions their treatment. Many of them answered that everything was as usual, the majority of them. No problems, they said. Some of them had stocks, medications and stocks. Some of them, a third group of lines, I do not get necessary condoms, for example. I do not get any medications for harm reduction or any means for harm reduction. AIDS center was closed in some spots in some regions or reduced the hours of services. NGOs, some of them were closed. I'm reading from top to downwards. Some of them didn't know where to go to get prevention means in the quarantine conditions. Quarantine in the city, I can't go anywhere. I don't use the prevention services, almost the bottom line. And the very bottom line, it's difficult for me to answer. That's the spectrum of the answers of the patients we were surveying. COVID-19 testing and availability of medical care in connection with the symptoms of new infections. We're reading from left to right. HIV positive, not all of them were eager to go to look for medical services. And those who answered yes, they are in blue. No high % of those who do not approach services. So that's the explanation. Months starting from March, when the result of coronavirus testing was acquired. And you could see how the situation was changing from March to July 2020. If during the first wave, there were not many people who were eager to get tested, and starting from April, the numbers started going up. People who were diagnosed by doctors, previous slide, with coronavirus infection, number of people from the environment who were diagnosed with COVID-19. First, nobody, then 1, 2, 3, 5, and more than 20. We asked them how many people you know who are infected with HIV among those who had or had coronavirus infection from your environment. Again, first none, then 1, 2, 3, and then growth of the numbers of people. Some people to the right side of the slide answered that I do not know the HIV status of those who overcame COVID-19. So COVID-19 rates started growing up, and it's necessary to continue studying, especially vulnerable groups of people, vulnerable from point of view of chances to get COVID-19, people with HIV. We are in need of in-depth studies among patients in the centers, prevention centers, in the AIDS centers. We have to think about planning similar, a new, maybe second, similar, and we are doing this survey at the beginning of 2020, and we need just to get more reliable data, and that will help us to introduce additional measures. We are in need of this just to observe the quality of the sample, the representatives of the sample we are talking about. That was about our survey. If there are no questions, probably I'll complete my presentation. This map shows the distribution of ART medications, drugs during a pandemic when the borders of Russia were closed. We started thinking, we tried to think about all groups of population, about people who were, so to say, beyond the borders and had no connection with the inside of the country and vice versa. So we tried to develop ways how to and patterns how to help people who were trapped beyond the borders of the country. For example, we could say that there were 49 countries where they were trapped at the beginning of the pandemic, and there were more than 700 of those people in different parts of the world, including Balkan countries. Some of them were trapped in Russia and other regions that were closed, in Poland, in Czech Republic. Some of them were in Germany. So people, I'm talking about people living with the HIV. And we should not forget about such group of population as migrants who come from CIS countries, from Baltic countries, and who are traveling because the conventional schemes of provision with the ART could be interrupted because of the pandemic. So to follow, so to say, the routes, the schemes, their availability, their vitality is very important. A little bit more about assistance for such people who were trapped in the territory of Russia because of pandemic. We have such organization as Patient Control, and the representatives approached a number of countries and asked to launch fundraising with the aim of providing assistance with the ART drugs for foreign citizens who were trapped in the territory of Russia. And here we show the results of the fundraising launched by HIV core, most active core, the assistance in the territory of Russia with ART drugs. We show here how many people from Ukraine, Tajikistan, Moldova, Kyrgyzstan, Uzbekistan, Kazakhstan, Armenia, and other countries, how many of them got such assistance, such help. Information about the courses of treatment, how many people, 1,303 monthly courses. RT drugs were provided for 527 people. We are reading the slide from top to bottom. Downwards, 307 people got a treatment from 2 to 6 months. Efavirenz, 240 packs. Dolutegravir, 211 packs. Lopinavir, ritonavir, and so on. The drugs we were dealing with, we were providing for this group of people. And we are happy that living in such not very easy times, we were able to organize and implement a kind of a unique project. And due to our effort, many people being in a foreign country got our assistance, our help, and they did not interrupt HIV treatment. So due to the effort of Patient Control organization, Patient Control is a movement, just quite impressive campaign. Thank you for your attention. Alexei, thank you very much. I forgot to tell you, dear colleagues, I'm talking. We have chart function here. This information is both for our participants and for YouTube participants. Don't forget about this. So you are welcome with your questions. In this function, you'll be able to ask your questions. My question to Alexei. Well, it is behind a little bit, but I must ask you just but. Oh, you mentioned that one of the results of your survey was the following: people were not. Am I right? Understanding regarding the knowledge about the status? It was not connected with pandemics. situation, people who didn't know their status. That's one of the problems that always was there on our agenda. People tend to, some of the people tend to miss scheduled examination, what we call in Russia dispensation. If they feel themselves okay, then they do not go back to find out about their status, even after testing. Oh, yes, we could discuss this problem. It exists, but I can't say that we are very pessimistic in this area. Actually, during our survey, focus of our attention was on their possible interruptions of treatment. And actually, we wanted to find out about availability of laboratory equipment. We wanted to know whether it was laboratories were equipped for COVID testing that could be a reason for lack of knowledge of their status in people. But we have to continue, as I mentioned, our survey. The main thing is to have the drugs at hand. As for your presentation, what would be great if you could share it with us? We could organize translation into English, and would be very interesting for our participants who do not speak Russian. And to have the results in English would be just great. I hope that you will not leave us immediately, that you continue to work with us today. And it would be, if we are lucky, it would be very interesting to listen about the results of the second stage of your study, or the second study, as you mentioned. Well, one could even think about participation in your study. To work together with you would be very interesting. I hope that you are well informed and you know about the European group that in June or in May published the results of the Express study, and they continue working, they are studying the opinion of the focus group people. Thank you, Alexei. In normal conditions, had we been in St. Petersburg, all of us, and before passing over to the first wave of our program, it would have been a good idea to give their microphone to the Committee for Health of St. Petersburg, to our hosts, and I would like to invite the deputy head of the Health Committee of St. All esteemed dear colleagues. We're happy to have here our esteemed experts. We would like to share this presentation with you tendencies of the development of the situation in the area of TB HIV in St. Petersburg.
So what about the connection with the committee? As far as I understand, well, first of all, Alexei, I would like to answer your question, which is which you asked via the chat, that whether your speech actually was clear. Well, I have no questions to that. I suppose that it was absolutely clear, transparent, and everybody understood you well. Now, as far as I understand, the Health Committee of St. Petersburg is still struggling with the slides. Okay, now we have it. And now, with the microphone on, dear colleagues, can you see the slides? That's good. Can you see the slides? Can you hear me well? Is everything all right? You have not selected Russian. Please select Russian. While we're still into the technical issues with the Healthcare Committee of St. Petersburg government, I would like to make another comment. This novelty innovation, when the AIDS Center provides and delivers all the ART drugs for 3 or 4 months to patients, I suppose that this particular practice will be ongoing after the pandemic is over. I suppose it will be very interesting to learn the opinion of the AIDS Center representatives when they start their talks. I suppose we should ask them. Dear colleagues, can you hear me? Can you see? Yes, everything is all right. Now we are going to start. We are going to speak about the trends on HIV and TB in St. Petersburg. Now let's look at the statistics, the number of detected cases. For the 1st of January 2020, 59,077 people, number of those who died, 16,379 people living with HIV, 43,594. In 2019, we notified and registered 2,870 cases of HIV infection and 1,583 among the citizens of St. Petersburg. So the share of people who are temporary in St. Petersburg is 72%. I would like to provide you with a graph of the prevalence dynamics in St. Petersburg. You can see it in comparison with the whole of Russia, with the data for the Russian Federation in 2019. We have, and 2012, we have a merge of these two curves, but thanks to very good anti-TB and HIV service in St. Petersburg, we have a very good trend in terms of decreasing the HIV infection rate, and it's an ongoing trend. In this particular graph, I would like to draw your attention to this particular peak in 2001. It was the synergy, the result of a synergy of two factors: the drugs traffic through St. Petersburg that actually brought about the spread of HIV infection, and at the same time, there was a huge surge in the detection rate. Further on, you can see a very good work of our police departments, and the drug trafficking through St. Petersburg was curbed. And also the detection rate was remained very high. And as a result, we have this trend towards reduction, which is ongoing once again. Now look how many people were doomed to be diseased or just to have HIV among injection drug users. Now this is the structure of primary HIV detection among St. Petersburg citizens. You can see permanent citizens of St. Petersburg are prevalent, but also a significant part of those who are HIV positives are those who come from other cities of St. Petersburg, as well as people who come from abroad. You can see that trend is that the share of those who are migrants to St. Petersburg, in fact, is even higher. I suppose this is related to the fact that St. Petersburg is very attractive to the migrants. And as you can see here, the trend towards reduction of incidence rate could not happen just occasionally. All this is mainly related to a very deep and comprehensive work of different services of the work of the service. For example, specialized settings. The coverage of people of St. Petersburg with testing is ever growing. Here you can see the prevalence of HIV among different age groups. I would like to draw your attention to the fact that it hits the regenerative and also reproductive and working age population, and this is the biggest problem. You can see that the prevalence is, we have a lot of men affected, and they're working age, reproductive age men, which of course results in increased risk of spread of infection. The main transmission pathway of HIV infection in St. Petersburg. In the beginning of the 21st century, it was a parenteral pathway through syringes of IDUs, for example, but as we combat, gradually as we combat the drug use here, and we have disposable syringes nowadays, the role of parenteral pathway comes to the minimum, and at the same time we have the growth of sexual transmission pathway. Now you can see cases of lethal outcome among people living with HIV between 2015 and 2019. So death because of HIV as the main cause of death. The trend is towards reduction of this particular indicator. So when the virus was first discovered in the end of the previous century, it was actually, it was the diagnosis that doomed a person to death. And of course, it meant very unfavorable outcome, as well as the development of disease was very fast. At the moment, with the development of science, diagnostic modalities, and testing coverage, of course, we have much better results, as well as the therapeutic approaches that are available to population today. So you can see that the number of those who passed away among HIV positive from traditional diseases, that people die among the HIV negatives. In fact, now we have the same structure of death or course of death. Now you can see distribution of causes of death among those who are HIV positive in 2019 in the territory of St. Petersburg. As you can see, we can look into this red bar. These are people who died from HIV or complications of HIV. Usually this is TB or other opportunistic infections. I mean those infections which as a matter of fact, are not lethal if there is no, if the person is not immunocompromised. This is pneumocystic pneumonia, mycobacteriosis, toxoplasmosis of the brain, cryptococcus infection, and primary brain lymphoma. And also multi-lesion leukoencephalopathy. This gray segment, 35.1, this is HIV as a cause of death among HIV positives. So the number of HIV positives which are registered and come to our HIV service is quite high. And this is also indicative of a very good and successful work of our HIV service. And as soon as it grows constantly on regular basis, we have a much better coverage nowadays of dispensary follow-up, which accounts for 85.1% of those who should be followed. This is very good coverage. It's one of the highest all over Russia. It's one of the highest in Russia. And also, if you look at some other region with the overall number of those who are contaminated or those who are just HIV positive, it will be approximately 70%, not higher than that. So it actually shows that we have very comprehensive approach to our services in St. Petersburg and in the region. So the number of HIV positives on ART, this graph shows by the trend starting from 2001 up to 2019. You can see exponential growth of those people who are come to receive ART drugs. And at the moment, the coverage with ART of those who are on dispensary follow-up accounts for 67%, which is again a very good indicator. Now we're going to move on and speak about TB. This is a prevalence rate for the Russian Federation per 100,000 of population. Now you can see the yellow bar is prevalence, and the red bars, they are mortality. Starting from 2010, we have started just a very important battle against the spread of TB, and you can see steady trend towards the reduction of both mortality and morbidity. And you can see the number of detected cases for the 1st of January 2020 is over 1,000 cases. Number of those who passed away, 2040, and those people who are temporary in St. Petersburg is 21%. So it's quite high. Now, please look at these two curves, which show mobility in St. Petersburg and in the Russian Federation. So St. Petersburg is red and Russian Federation is yellow. You can see that both in Russian Federation and in St. Petersburg, we have quite significant trend towards reduction. But I would like to show you the difference, which tells us about the fact that physiatric service in St. Petersburg is very well organized, and it's on average an average high level if compared to the whole trend of Russia. So among the structure of territorial structure of morbidity with TB, in St. Petersburg, you can see that the yellow segment prevails. These are permanent dwellers of St. Petersburg, but we also have great number of those who come over to St. Petersburg from other cities or from other countries of the region. Also, we have great number of those who are transported here through the penitentiary system, and also those who come from other cities of the northwest of Russia and other regions and subjects of Russia. Also, we have migrants from other countries of CIS region who come here and get diseased with TB or bring about infection from other regions. So now you can see the prevalence of TB in Russian Federation and St. Petersburg, despite the fact that it's quite Nordic region. It's quite damp here. And in the 19th century, this was a huge problem for the spread of TB. It's cold and damp climate, but you can see that science nonetheless allows us to win this battle over St. Petersburg, over TB in St. Petersburg. And I would like to say that at the moment we have a steady reduction of prevalence of TB. Now, this is the bulk of primary MDR TB in St. Petersburg. So I talked about TB, Mycobacterium tuberculosis. I talked about Can you hear me? Dear colleagues, can you hear me? Yes, we can hear you. Good. So as you can see, we have stories, we have ups and downs here. And now you can see certain reduction of the MDR TB. And this particular indicator had a just rebound that it grew again in 2019. I should say that the prevalence of respiratory TB with MDR and without is showed at this slide. Here you can see actually the ups and downs and the pros and cons and everything. The stories of success and the lost battles are all in this slide. There are certain periods when we managed to bring down the number of primary cases of MDR and we start actually providing treatment and they start responding to it. But there are some years when and we have smaller number of patients with disseminated MDR TB. But there are other years when these stories are not so successful. Now here we have new cases of TB with co-infection with HIV. I shouldn't say that it's a good trend, but there is a plateau at least. I should take this terminology from coronavirus infection. So it's our dream to reach a plateau in COVID-19. So here we have the plateau already. So I suppose that we should be waiting for trend towards reduction soon. Now, when it comes to St. Petersburg, new cases of co-infection, again, it looks like a plateau. Now the share of HIV positives within the TB service. So the overall number of TB cases has a trend towards reduction, and I have demonstrated that in the very beginning of my talk, both in St. Petersburg and in Russia. But at this background, we have relative growth as far as I understand of HIV cases.
Number of patients died of TB in the Russian Federation. Number of patients with TB who died of other reasons. Here we have it. Number of patients who died of other reasons in the Russian Federation. We have a little bit of technical problems with slides or sound. I hope that the committee will be back soon. I'm awaiting actually more actual fresh data data for St. Petersburg. It was a pleasure, of course, for me to see the data, regarding incidence and fatality in people with HIV is going down. During the last years, it's going down, but how the average is regarding age of people with HIV changing, how it is changing the age, maybe mean average age in connection with what reason, effect, impact. The point is that I saw that in Russia, some Russian yeah, Tatiana, you are welcome to answer right now. Just please, if you are welcome. Just can't see, we cannot see you as of the moment. Can you hear me now? Yes. If we speak about lethality of HIV, they are 35 to 45. Speak about the reasons usually diseases connected with HIV. And these are people, that were people who knew about their diagnosis for years, but because of a number of reasons, some reasons, they avoided AIDS centers, they did not take medications, were mentioned. They did not take ART drugs. Why? They did not take drugs. First, they used to feel okay at the beginning of the disease. It's obvious. They avoided medical care. And the second reason is there. It's HIV/AIDS dissident. People say that does not exist. Maybe it exists, but not in me. It's quite a banal reason. Another issue is that we try to work with this group of people, we work among HIV-infected, positive people. And of course, the situation is improving. We try to involve to people in testing, and every year we test more and more people. And that's one of the reasons why the general number of patients is growing up, because we cover them with testing. Thank you very much. Nice to have you with us. My pleasure. As far as I understand, whether the committee, St. Petersburg Health Committee, is back with us. Maybe we'll continue. Well, let's go back to the committee, to the St. Petersburg Health Committee, if they can hear us, if they can share. It's our pleasure to listen to the end of your presentation. You are welcome. We can see you. We can see the slide perfectly. We can hear you now. Number of TB patients died of other reasons. There was a tendency towards stabilization, but this curve shows same type of statistics that we have discussed. TB and HIV, the proportion of TB in HIV patients, usually it's in the later stages that we identify this situation. And the role of a chest X-ray for early identification. This is the point why we show this slide. Proportion of patients with comorbidity, HIV plus TB, and opportunistic infection in the structure of those who were hospitalized in the clinics in patients. People, the proportion of TB here is obvious. ART in patients with HIV and TB. Just TB is in blue here. TB plus opportunistic infections is in red. Regretfully, there are some interruptions in sound. Let us continue, maybe. Regretfully, the communication with the committee has been interrupted. I would like to thank them and say that if there is an opportunity, it will be our pleasure to listen to you, to ask your questions. And Alexander Panteleev would like to hear his opinion about the mean age and a couple maybe of examples of typical people dying in St. Petersburg of HIV and TB. Well, let's move towards the west, several thousand kilometers. Let's cover a couple of thousands of kilometers. We are moving to Germany. Let's listen to the representatives of NGOs, not state supported. I'm not quite sure who's going to start speaking. August or Christoph, the floor is yours. Astrid or Christy, share the screen, please.
Yeah. Hello, good morning. That's me, Astrid Leicht from Germany, Berlin. First, I want to introduce our small representative group. That's the first person who is unfortunately missing is Ulrich Markus from Robert Koch Institute, which is a health department from the Health Institute. No, I have to read it. The Public Health Institute in Germany. The second, but we will represent some numbers. He would have presented it today, I think. Christoph is my colleague. He's a medical doctor from the Checkpoint in Berlin, and me, I'm in the management of Fixpunkt, which is an NGO in the field of harm reduction for drug users, HIV, viral hepatitis since 30 years. We will show you first some data about, we only will show you a few data. We are not prepared for data, but for a report on practical issues. But we have brought some actual data from this morning about the COVID situation in Germany, because we are, yesterday we started the second so-called hard lockdown, because we had some rising numbers of COVID infections and deaths, and the epidemiologists in our conference will understand those numbers, which means that we have a 7 days incidence of COVID infection below 200, which was higher before, but we are still in a heavy critical phase of the COVID pandemic. Now I will hand over to Christoph, who will report about our work in Berlin, how to prevent HIV, AIDS, viral hepatitis, STIs, and how the COVID pandemic influenced our work.
Hello, good morning, everybody. Can you hear me? Hello, can you hear me?
Yes.
Yes, okay, can you see my slides?
Robert Koch Institute, COVID-19 dashboard, Germany, 1720. Yep.
Okay. Thank you for your very kind invitation and the opportunity to participate in this discussion and to present our hygiene concept, which we implemented in the first lockdown in Germany in beginning of March. My name is Christoph Weber. I'm an infectiologist and I am the medical director of Checkpoint Berlin, which is more or less a community-based checkpoint. And first of all, after this nice introduction from Astrid, I would like to briefly present our project, Checkpoint Berlin, as a testing project for HIV, hepatitis, STI, for MSM, trans and inter persons. And in addition, we offer treatment for STIs, we offer pre and post prevention, exposure prophylaxis for HIV, and we had about 5,000 visits in 2019, which is about approximately 100 per week. We started our project in 2018, so we're quite a new one. And I try to give more practical insights than rather statistics. I would like to introduce you to this checkpoint as a testing project. As I said already, we also offer the pre and PrEP and PEP. And I would like to tell you where we are. This is the map of Berlin. We are located in Neukölln. And when you look at the yellow flag, this is where we are. This is our housing, and we are on the 3rd floor. This is what we offer to our clients, meaning HIV services, STI services, hepatitis, PrEP and PEP. And we do counseling, lab stuff, and we do have doctors here to spend treatment.
Christoph.
Just one. Yep.
Sorry for interruption, because I think we have some problem with your slides, because we see just one slide. It is never changing.
Okay. Oh gosh.
Can you see? No, it's no problem. If you. Yes, now we see testing and counseling at Checkpoint Berlin 2020. Yes.
This one?
Yes.
Do you see the map? Do you see the map?
No, we see just testing and counseling at Checkpoint Berlin with the graphs by months from January to October.
This one? Okay. Okay, can I comment on this?
Yep, please.
Okay. This is our testing and counseling figures for 2020. And as you can see, we have this come down of figures in April while the lockdown was, and it starts again in May, June, but we never reached the figures we had before. So we obviously do not provide as much services as we did before. And do you see that? Do you see the change?
It is the same slide. Maybe if you go back and move the slide. I mean, if you go from the full screen mode back into the your slides change.
Wait. Wait again.
Maybe you just if you yes. Now
Okay,
we see we see another one, checkpoint building visitors and employees.
Okay, so our focus to protect our services was, we were thinking about social media. We thought about the door policy. We wanted to protect the visitors and we wanted to protect the employees. And I will show you how we did that, or how we managed to do so. I hope you see another slide now. Nope, you don't. Okay. Again, better? No? Okay. So we used social media and our website to announce that we offer, at the time of lockdown, a reduced service. And so we pronounced that we do prescription for PrEP for those who are in need for PrEP within the lockdown times, and we do offer services for symptomatic STI only, not for asymptomatic and not for routine checks. All who need PEP, we were offering PEP and HIV tests when there was a risk contact in the last 6 weeks. What we didn't want to offer in that days of the first lockdown was the routine testings to avoid contact or reduce contacts, because that was something we are supporting. And we invented appointments via the internet, like video-based counseling. Okay, and again. Change of picture. Yeah, okay. So our door policy was, so that was the second focus we had. Our door policy was, we measure temperature at the entrance and we do active call to wash the hands. And there was a duty to wear face masks. And we had these lock-in registration options by QR code, so that in case we would have detected a positive case, we would trace, or better said, we can inform the other people who was there, because we are offering anonymous test and treatment. We were usually we are not able to call them back because they do not offer us the telephone number or any address or something like that. So in case someone showed up with a temperature above 38 degrees, which was at that time the only thing we could measure or we could determine as this might be COVID, visitors were either rejected or isolated in a separated room, and HIV PCR were offered to rule out acute HIV infection, because that was our different diagnosis if someone showed up with fever. Can you see another picture? No? Okay. So what we did indoors hygiene measurements were sure duty of wearing a face mask, active seat assignment. So people were actively seated, that there was at least 1.5 meter, that they were sitting 1.5 meter apart. And recently we could implement it in our concept a air filter plan to reduce aerosols so that everybody could feel safe in our space. And for our employees, we implemented strict rules. So we did a daily PCR swab, which we pooled, and so 5 were pooled in one tube, and we checked whether any of those were positive for COVID. And we invented a sequential work cycles, meaning that everybody works like Monday, Tuesday, Wednesday, Thursday, and then the next follows, and in a row, but not like spotted or scattered ones, like on Monday or on Wednesday. So all in a row to make the daily PCR swab working as a very, very, very early sign before someone became infectious. So we can stabilize our own structure. Even if someone would be positive in the days, he could go for a quarantine or isolation, and the structure of the checkpoint would be safe because it was before they really get infectious. Then the usual hygiene measures, that was clear, and we reduced contact times to less than 10 minutes, and we invented this video-based counseling, which was very appreciated by our visitors. And what else? We invented the every 2 hours hygiene rounds, which disinfect all door handles and ventilate the rooms at least for 10 minutes. So we could have these, or we tried to make the employees and the people who comes there very, very feeling very safe. And yeah, and this is just a picture where we put everything together. And this is our hygiene concept at the moment. The lockdown has forced us to additionally come to these reduced reduced services. Since yesterday, we are all supporting the idea of lowering the contact. So we are busy with video-based counselings and try to manage to bring only people here who need to be need treatment or definite testings. I think this is it for the moment. It's just a briefly overview over our hygiene concept.
Thank you very much, Christoph. Thank you for your presentation, and it was very nice to meet you both. So I'm asking people if you have any questions, any comments, so please use the chat box, but I have 2 quick ones. First, your lab your laboratory resources, but you are doing PCR testing for HIV, yes. Right? No. Have you ever had to shift your laboratory resources to COVID response? I mean, to COVID-19 identification, or?
I'm not sure whether I get your question right. What we do is we just take blood here and we do swabs, but only for our employees, and we send it to a huge lab. It's not that we do the PCRs on spot, right, here.
Right. Right.
So,
Yeah.
So we don't have to move anything.
Yeah. Yes. Thank you. And one more question, because as far as I know, Germany is now on the eve of a strict lockdown that is coming in the end of December for a couple of weeks, at least for a couple of weeks. So do you expect this lockdown may produce any impact on the performance, on the work of your organization?
Actually, I would say yes. As you could see on one slide, when I showed the test and counseling over the year, and I think we will have a reduced, people will be not will to do HIV tests right now. Either they are scared or they are, they're scared for COVID, or they are not sure whether they are supposed to use it right now because they might have no sex at the moment or less sex. So it will influence our work that we think lower figures of testing means higher numbers in the end of HIV or of any other STDs.
Yes, correct. Thank you very much. Thank you, Christoph. Thank you, Astrid.
No, Astrid, I think, is still.
Astrid is still, okay. Oh, sorry. Okay, Astrid, then
I have prepared I have prepared a lot of information, but I will try to run quite fast through it. I want to add and connect to Christoph's presentation and report about harm reduction measures in Germany, and especially in our organization. I have prepared some slides.
All right.
It's what I wanted to show you. My first time in this kind of presentation. Do you see the first? You already know about. You see the first slide now?
Yes.
Okay, that's just to add. If you, we have one report from the Robert Koch Institute about the impact of the COVID pandemic on drug users, health promotion and harm reduction facilities. It's unfortunately only in German language, but if you have the possibility, you can check this link and read about research conducted by Robert Koch Institute in summer and reported in autumn. I will report about our experiences in Berlin. Berlin is the capital of Germany. Fixpunkt is quite big NGO working locally in the city of Berlin in several districts, and our target groups are mainly people who use injectable drugs like heroin and cocaine, and who are living in public spaces. Therefore, a lot of people we are serving are homeless and migrants. Some of them, of course, we have a quite big proportion of migrants coming from the Eastern European countries and the Russian-speaking countries too. So you were reporting before that you have migrants coming back from Germany, and those people are in Germany, of course, too, and are using our facilities. We have another target group. Those are migrants who are not using injectable drugs, but are at higher risks of HIV and viral hepatitis. And we have a special access to West African men and from other parts of Africa who are supposed to sell marijuana in a public garden quite close to our main office, which is called Gorlitzer Park, and which is quite well known all over the world, I think. Yeah. So, but our focus is health promotion in general and the prevention of severe transmittable diseases like HIV, viral hepatitis, and now since March, COVID-19. And we are running low threshold facilities for people who use injectable drugs and who are living in public spaces and who are consuming drugs in public spaces. Fixpunkt contains of two organizations, two NGOs, but we come from one offspring. And all in all, both two Fixpunkt organizations consist of about 100 persons who belong to the paid staff. Some of them are only working with us for a few hours per week, some are full-time, and we have a few people who are working and contributing on a voluntary basis. And we are funded mainly by the city of Berlin, and additionally we get some money from the European Social Fund. So this is a short overview about what we do in the field of harm reduction. First, we have 20 vending machines running since 30 years, since the beginning of the AIDS epidemic, because the distribution of needles and syringes 24 hours a day via machines is a very effective measure to prevent the infection of HIV and hepatitis. We are running disposal boxes in public spaces. This is a quite new intervention measure. You see it on beneath the vending machines. Then we started 30 years ago to run mobile units that are big vans driving to different places where drug users are meeting and consuming. Additionally, we do outreach work by foot or by bike. You see the you see the bike with a box, and we can promote information materials and harm reduction materials. We are running 4 drop-in centers. 2 of them have drug consumption facilities. The left one is an injection room. The right picture you see is an inhaling room. And we offer the typical harm reduction program you know from other countries and other organizations, like the promotion. We give harm reduction materials like needles and syringes. We dispose them. We do not exchange. Since some years, we give people as much as they need for hygienic procedures in injecting. Of course, we do social work, we do medical counseling, and do the HIV, hepatitis, and STI testing too. And we try to navigate people who need further support to other organizations and institutions, and we involve community members and, of course, people who have special skills in language and culture mediation, because we have a lot of migrants, as I said before, who need support and orientation in our city. So what are we doing normally since a lot of decades? It's health interventions and harm reduction measures connected to illegal drug use and addiction, HIV, viral hepatitis, and tuberculosis is an issue too, but it's we are don't have big numbers of TB in Berlin, so we are always alert about TB, but there were only few cases we had to manage. And another issue is the prevention of overdose. We are able to prescribe naloxone to drug users after a short intervention of emergency training. So what changed, or what had to be added since beginning of the COVID-19 pandemic? First, as Christoph told you, is that we are now in the second wave. The first wave starting in the beginning of March until May. Our organizations, harm reduction organizations in Berlin and all over Germany reported that there were only a few cases of infections of COVID in staff, and really no cases in our clients. And this changed in the second wave, which started in the beginning of October, and now is on a quite high level. Now we have cases in our staff, mostly from private sources. I don't know in our organization at Fixpunkt, we don't know about infections happened during work. We have, of course, quarantines more than in the first phase. private sources too, children at school, partners. And we know about a few cases of clients. We don't have any information about outbreaks, which means that one place, public place, or one group of drug users or one staff is heavily affected. Now it seems to be only single cases, but we have to be alert and wait and obey if this situation changes. So all in all, we proceeded with our harm reduction measures because those, in general, they fit to COVID prevention too. As I said before, TB prophylaxis or TB prevention and alert is the basis for COVID. But of course, we have to be more alert because COVID is much more higher infectious disease than TB. So we offered special information on COVID transmission to those people who are not all speaking German, who are not able to read maybe written information. And so we had to transport a lot of information about the situation in our city, about prevention measures, about the legal situation, what is allowed, what is forbidden. And of course, we started to offer practical intervention, like you see the hand washing and disinfection, washing basin and disinfection facility. We offered disinfection for hands for the people to take away, not in the first phase because there was a limited access to disinfection materials and protection materials, but now in the second phase we are well equipped, and so about 3 weeks ago we started to hand over FFP2. It's a personal the mask, the medical mask you see here. KN95 is an English American term, I think. So we hand over those masks to clients too, and not only to staff. And we shifted during the last weeks from more voluntarily, you should take your mask, you should take your FFP2 mask to it's obligatory now. So we have to improve and strengthen the protection procedures. And of course, we always looked for keeping distance, 1.5 meters at least, you see. And what are the challenges now? A lot of challenges. I think the time is too limited to talk about a lot about everything in detail. But as you might ask yourself, what changed in the first phase, what will be happen in the second phase, what will happen now, we don't know because we just are in the second lockdown. But the first lockdown, we had less influences on availabilities of substances. We were in fear of that because the traffic slowed down and no planes, no trains, less cars. But the drug market the illegal drug market was really well organized and provided drugs on the illegal market as before. It was, but it was for drug users, it was more difficult to get access to money, to begging, asking general population for money, collecting bottles to sell them, and stealing purses and everything. That was quite difficult for the people. The good news was that the access to OST, the substitution treatment, was improved. And this was really supported by a decrease of the German health authority to a big degree, but it's still limited access for opiate users who have no health insurance. Of course, we had in the first phase and less access to night shelters, and now in the beginning of the second phase too, but I see improvements in progress, at least in Berlin. And the same is for opportunities to stay in daycare centers for homeless people and for hygienic access to hygiene. yeah, we had a lot of still have to cope with a lack of information for the highly vulnerable people, but we're still talking every day. We are talking about COVID and of course about other infections, because we all know that HIV and hepatitis are not did not disappear. They are still in a big danger. The drug users themselves, we saw in the last months a decrease in the general health conditions. So we are afraid that the long-term influence of COVID is not still known, but we are aware that the situation of the people worsened during the last months. We had, of course, repressive measures. We have more police, more controls, and this also influences the health condition and the social condition of drug users. And yeah, this, some information to this about the staff. Of course, the staff is, we have an experienced staff, a dedicated staff to HIV/AIDS, but during the first, especially during the first phase, where we only had a few information about transmission, about protection. There was a lot of fear, and people, the staff felt unsafe, and so the staff had to change behavior. Before, staff was used to counsel drug users and migrants, but they were not used to that threatening disease is affecting themselves. And so especially in the beginning, we had a very unbalanced reception of risks, that the colleagues were not recepted as big as to bring the disease than clients. And so we had a lot of psychosocial problems to manage, and but this got better time by time. And we see, of course, not only staff, but clients, we all have individual strategies how to cope with, and we are still learning every day how everybody is able or not able to look for how to protect oneself and how to protect others. And my conclusion is that, my key messages I brought to this conference is that all in all, our hygienic and procedures and harm reduction messages are still the same and mainly fit to COVID-2. They are not contrary to COVID, but of course we have to add some measures like reduction of physical contacts, to take care of, to keep physical distance, and the mouth and nose covering, additionally the FFP2 masks. And what is still important is that we support each other if we are affected by ourselves, that we remember evidence-based strategies to manage our contacts and to check our risks and how to go on if we are infected by HIV, by COVID. Yeah, and as I am in the field of HIV/AIDS prevention for 30 years now, I remember that some of our reactions, some of the developments we are experiencing now happened 30 years ago in a smaller scale, of course, but I think we can connect our experience of HIV/AIDS prevention and coping to COVID-19. And that's all I wanted to say now. Thank you.
Thank you very much, Astrid. I didn't quite catch what happened 30 years ago.
It was when the first information about HIV/AIDS came, we were very alert. We didn't know. In the first phase, we thought, oh, it will not affect us anyway. Then everybody thought maybe we get AIDS by kissing, and that everybody is affected. And we had to learn to check out what are the real strategies and the real risks.
Yes, yes, correct. And we're still learning. At least many people are still learning this basic knowledge about HIV and transmission. Astrid, thank you once again. I have one short question to you. Do you see that the COVID-19 pandemic has speeded up the turnover of your clients, that more people are now lost to, let's say, lost to follow-up, and more new clients are appearing on the horizon?
In the moment, more clients, the clients are still coming. Some are not coming as the same time, the same intensity like before. So we have not lost them at all, but they also reduced their contacts, and yeah, but they are more in need, especially during the lockdown phase. They were really in need of our support because there were no other, nearly no other facilities open, and the people had problems, more problems we didn't know before, like hunger, for example. They really needed food and water and basic support.
Yes, correct. Thank you very much. And once again, that was, I mean, I don't say goodbye to you, but just I want to use this opportunity to say that that's a big pleasure to meet you and Christoph at our event, and thank you very much for your input. And now I'm shifting to the Russian.
I'm in the Russian channel. Dear colleagues, so we are lagging behind, 20 minutes behind, but I would like to give the floor to Alexander Pantilev, Deputy Head of the Committee for Health in St. Petersburg. And that question about the mean average age, is it changing of those who died? I mean, patients died of TB, average age in change. Can you see me? Can you hear me? Good afternoon. Pleased to see you. About the question, the simultaneous increase of the average age of TB and HIV patients. It was 35 years, 5 years ago. Now it's 40, 45, maybe 10 years ago, it was 35. The rest, I mean, the picture is same. It's 40, 45 with HIV and TB, lethality of those two regions, and more combinations, so it's combined reasons now, so the age increased. It's our pleasure to see you, colleague, whether it's through their screen or not, but we are very pleased to see colleagues. It's my pleasure to make a break. Let's take 15 minutes. It's 5 past 1 in Russia, approximately. It's 11:07 in Europe. Let's resume our work at 12:20. Thank you. See
And now we're going to listen to the Agency of Healthcare of Sweden. Of course, on the first pages of the mass media sources, it will be very interesting actually to hear. We are talking about COVID. So it will be very interesting to know what they do in Sweden in order to what they do in terms of COVID-19 as well as STIs. So Torsten will talk about the experience of one of the low threshold centers. I mean, low threshold centers, which or clinics which work in Stockholm, in Sweden. So
okay, so is it time for me?
Yes.
Okay, so I say hello to everyone. I'm glad to be here. My name is Maria Axelsson and I'm working at the Public Health Agency of Sweden. And I am head of unit for the epidemiological monitoring. So I will see now if I can share my screen. Share. So is that okay? Good. Very good. So it's me and Torsten who will talk a little bit about Sweden today and about the COVID-19, but also a bit about HIV, TB and STIs. And we will also hear about the experiences from a low threshold clinic here in Stockholm. So I will start with giving you the picture about COVID-19 in Sweden. So this is a picture telling us about the confirmed cases of COVID-19 during the whole year. So you can see that in the spring we had like a lower peak of COVID-19 cases, but then was the green bars are from the priority testing. We only tested very severe cases, mainly in healthcare, in hospitals, and also some staff groups like healthcare workers. But from the beginning of the summer, you see the purple bars, and that's when we started with a very generous testing. And then you see we have a very high peak in the middle, since the middle and the end of the autumn. We have 357 cases as an incidence per 100,000 the first week of December. We make between 250,000 and 260,000 tests per week. So of course we find also very much more cases now compared to the spring. So here we see a little other picture of the disease and the epidemic and the pandemic in Sweden, because you see that the ICU cases, people who has been in who are in intensive care unit, they are still much fewer in the autumn than it was in the springtime, because we find so many other people now with the very mild diseases. Okay, I hear also the Russian, but maybe that's normal. No, okay. Okay, so I think I was done with this one. We have had more than 7,000 deaths in Sweden in COVID-19. I think it's like 7,800 deaths right now. and we have more than 350,000 cases totally. So it is still, even though you see this picture is more not as bad in the ICU departments, but it's still a very problematic situation in Sweden with the COVID-19, and we have it's a very high pressure on the healthcare, of course, since beginning of March in Sweden. So I will go quickly through some of the diseases that we have been looking at, the impact of COVID for these diseases. Here we have HIV. This is number of cases, reported cases from January to November, compared the last 5 years. And we have a little decrease, 7% of decrease in the HIV cases. Put you over there. We have in HIV about 75 or 80% of the cases are people who have are migrants to Sweden. So of course we know that the migration is also has a big impact on our trends of HIV, for example. We have also 17% decrease in gonorrhea when it comes to earlier years, and a little slight decrease in chlamydia. The majority of the cases for chlamydia and gonorrhea are infected in Sweden. And also then we see tuberculosis cases in Sweden. We have a decreasing trend since 2016. We had 35% decrease of tuberculosis cases 2020 compared to 2019. Tuberculosis cases in Sweden also are diagnosed among immigrants, more than 85%. So migration is also a big part of this decrease. You can also see here, if you look at per month for the TB cases in Sweden, 2019 and 2020, you can see that the decreasing trend already started before the COVID-19 pandemic. You can see that it was already a decreasing trend in January, February, March, and so on. And to fulfill the picture here, we can see that the asylum seekers in Sweden since 2016 has been much lower the last years. It's a really decreasing trend of immigrants from countries with high TB incidence. So we see 68% less TB diagnosis in newly arrived immigrants. And we see a 40% decrease in asylum seekers versus 2019. So conclude for this, I have to move your picture a bit so you can see the slide like that. So we have the summary here to conclude. We have a decreased number of HIV cases and TB cases reported in 2020 compared to 2019. And also a decrease in STIs, in chlamydia and gonorrhea. And that means for gonorrhea that we break more than 10-year-long trend in increasing gonorrhea in Sweden. But now it has been a decrease. As I told you, we have a reduced number of immigrant permits and asylum seekers these years, already since 2015 or 2016, actually. So the decreasing national rates in HIV and tuberculosis is mainly due to reduced immigration. But of course, we can see that screening capacity in healthcare also can be a part of this decreasing trend. We think that the decrease in STI diagnosis probably due to less traveling and less sexual contacts, but can also be have some, the limited testing or test seeking can have an impact on this also. So that was the general trends and the picture of these diseases and the COVID in Sweden. And I will now give the microphone to Torsten. If you don't think that it should be any questions right now, Dima, what do you think?
Thank you, Maria. I think we will move to the questions in the end of your combined presentation.
Okay, so thank you for now.
Thank you.
I will stop, or do you want to share screen with you, Torsten, instead? Maybe that's better. Yeah, I'd stop share here now. Okay. When you're not at the same place any longer.
Спасибо большое. I think I'm in the English language.
Thank you very much. Thank you, Maria. It has been a very interesting tool, interesting data. I was surprised by by such figures illustrating reductions in STD and TB. There were such figures as 35 and 40. Gonorrhea -17. It's impressive in comparison with the previous years. It could be a result of restrictions, less contacts, and clubs, nightclubs were locked down or closed, or maybe it's improvement of testing. I think we'll discuss it later. Torsten, I would like to give the floor to you. You are welcome. With my slide.
Yes, but we cannot hear you. At least I cannot hear you.
I hear you, Torsten.
Torsten, please choose the English channel and then also mute original audio. No, I cannot.
Share again. So the PowerPoint is visible. Yeah, okay. So thank you. I will share some data and experience from a clinic, a low threshold clinic in Stockholm that is directed to men who have sex with men. It's called Venhälsan, and I Special thanks to Dr. Göran Bratt and Dr. Finn Filén and Bernt Hildingsson Lund that has shared their experience and data with us today, but they couldn't join the conference due to patient work. Venhälsan, the clinic, is organized under the Department of Infectious Diseases at South General Hospital in Stockholm, the biggest emergency hospital in the region of Stockholm. And it has three outpatient clinics today. It's the STI screening clinic that is directed for men who have sex with men and opened already in 1982. And there, the second one is the HIV care and treatment clinic that opened in 1985. And now, since 2018, they have also the PrEP clinic for pre-exposure prophylaxis directed to HIV-negative men who have sex with men. And in the HIV treatment clinic, they have today 1,600 HIV-positive patients, of whom 80% is in the group men who have sex with men. And 98% of all these patients are on antiretroviral treatment. And of them, 98% have non-detectable HIV RNA, and 98% have CD4 count over 200. Normally, it's 1 to 2 routine controls for these well-treated patients on effective art, 1 to 2 routine controls per year. And so far, in this part of the clinic, there has been no special impact on the work with the HIV treatment. So it's running as usual due to the pandemic situation. And then we go over to the PrEP clinic. In Sweden, as in the whole EU, Truvada is the medicine you give as PrEP, pre-exposure prophylaxis, to prevent HIV infection in HIV negative. And it's covered by the pharmaceutical benefits insurance and subsidized by the government in Sweden. So it doesn't cost much for the patient. And we recommend it for persons at high risk for HIV, mainly in the men who have sex with men. As it says, this PrEP clinic started in 2018, and up to date it's 780 men who have sex with men that is on PrEP. After the start of PrEP, there is routine controls that includes STI and HIV screening every 3rd month. And now it's a waiting list for about 700 men who have sex with men in Region Stockholm that want to start PrEP. This is a high group of men who have sex with men who get PrEP, and 80% of them has been diagnosed with STIs before PrEP start, mainly gonorrhea or chlamydia, but also syphilis, 1 or several times. And also after PrEP start, we know that, and we can see that quite many of them get an STI, so mainly chlamydia and gonorrhea, but also syphilis. About 1/3 of these men who has started PrEP have diagnosed with STI after starting PrEP, but no one has got HIV. So far, it's a success in treatment, in prevention HIV. 7% of the men have stopped taking PrEP for various reasons. The pandemic impact on the PrEP clinic is actually that they have been stopping the inclusion of new PrEP patients already in March up to September. They couldn't include more because of not capacity in the staff. Many of the infection clinic departments staff is working with COVID patients. Then they started include again in October, but past inclusion in November. But some very high-risk HIV patients, high risk for STI have started PrEP anyway, despite of the pandemic situation. And there is also a reduced capacity for routine control. So they have decided that those in the group that have low STI risk, non-STI the previous year, they will only come every 6 months for now, instead of every 3rd month for all these routine checkups. And also they have introduced that nurse assessments for PrEP. Before it was only doctor that could do that assessment, but now nurse do it also in the clinic. And after inclusion, the doctor will prescribe Truvada. In this other part of the clinic, the STI and HIV screening clinic for MSM, they have diagnosed quite many STIs so far this year. Up to now, it's over 500 cases of gonorrhea and similar chlamydia, and 200 cases of syphilis. But also 16 cases of HIV has been diagnosed this year. In this group that have been infected with gonorrhea, chlamydia, and syphilis, a third actually are on PrEP. So also these figures show that the PrEP treatment reach a very high-risk group for STIs. And here are some diagrams. There you can see the trend over diagnosed HIV in MSM in this clinic, that it has decreased since 2018 and even more this year. But syphilis is increasing as previous years, mainly in HIV negative patients, and it has leveled out in HIV positive group. Also gonorrhea and chlamydia has increased, especially gonorrhea. Chlamydia is a little decreased this year so far, but gonorrhea is increasing in this group of gay men. So the pandemic impact in the STI screening clinic is that actually they have stopped do routine STI and HIV testing in asymptomatic MSM from March this year. They have only focused on symptomatic patients and patients that are contact traced for STI and HIV, and the PrEP patient group and their routine testing. Also HIV positive patients that always are offered STI screening annually. So there is a reduction of routine testing in asymptomatic MSM for HIV and STI in this big clinic in Stockholm. Also, they have introduced self-sampling, where the patient swab for pharyngeal and rectal sampling of chlamydia and gonorrhea if they are asymptomatic. And that was actually, luckily we did a pilot study the year previous in 2019 that showed good results. So now they can do this, offer the patient to do the sampling themselves, and they know that it will be, it's as high security in the sampling as when the nurses or doctors doing it, if they are instructed to do it right. And also they have no control test after antibiotic treatment of uncomplicated gonorrhea cases. Otherwise, it's a routine to always take a control test for gonorrhea after treatment. Here is just a picture of the self-sampling instructions and that the patient must read and get instructed for before self-sampling in pharyngeal and rectum. So to summarize this, there is a decreased number of new HIV cases in men who have sex with men in Stockholm in this clinic, and possibly they think mainly due to the PrEP that prevent HIV in this high-risk group with STI diagnosis. But also, of course, less immigration during 2020 can be reflected in the MSM group too. And then it's an increased number of gonorrhea and syphilis despite less routine testing of asymptomatic MSM. Probably about 30% less tests of STI and HIV routine tests this year so far. MSM with high risk as they are contact traced or have symptoms or are HIV positive, high risk PrEP persons, they have been tested despite the pandemic. Also we have seen that they stopped inclusion of new PrEP patients during March to August and now from November and ongoing. But there is also a positive effect of the COVID pandemic, and that is that they could introduce this self-sampling for patients with wanted to test for gonorrhea and chlamydia, and that has been accepted by both patients and staff. So.
Thank you very much, Torsten. If anyone has questions, please raise your hand. Please write a question into the chat box. So we will be happy to hear more information from Maria, from Torsten. I just to ask, I would like to ask a couple of, I'm on English channel, yes. I would like to ask a couple of very quick questions from you. So, Torsten, you said that there are about 700 people now
задать несколько вопросов.
On the waiting list.
Yes.
Is it growing?
Ожидания есть.
Ольга, я боюсь, вы на английский канал сейчас пришли. Вам надо пойти на русский канал.
The waiting list is probably increasing now because of the stop of inclusion. So it's a bit sad. Yeah, it has been longer last year, but also the gay group, the MSM, are more aware of PrEP now than a year ago. So many gay men want to start PrEP today.
Yeah, thank you. Right, and the second question is about the self testing for gonorrhea and chlamydia. Did I understand right that you started this pilot this year or
last year?
Last year.
They did with economic support from us, actually. So yes, they wanted to see if so it was a double study. They were tested both by nurses and themselves, so they could check if they were the same result. And actually, the patients were a bit better to catch the bacteria than the nurses.
Is it a combo test? I didn't quite catch.
Oh, it's it's a swab, you know, that you take.
Yeah. Yes.
Yeah. So,
but do you follow, or like if we look at the gender proportion, who are taking up these tests? Women or?
This is only in the screening of guys and gay men in Stockholm.
All right. Yes.
I don't think it's introduced in the youth clinics or so yet, but this was a way to shorten, because of the increasing trends of gonorrhea and chlamydia in the group of men who have sex with men. They had the idea that they could decrease the waiting also in the daily work for taking tests, if they could get patients to learn to take tests themselves. They already did the urine test, for urethra sampling by themselves.
Yes, there is a question from Antons in the chat box. Torsten, maybe I missed self-sampling. Does it mean sampling at home or sending by mail?
No, it's in the clinic. So it's when they have come to, because most of them also want to take blood sampling for syphilis and HIV. So this is the bacterial, but it could of course be done at home if they want to bring it home and go back with it to the clinic.
Okay. Thank you very much. Thank you both. Thank you, Maria. Thank you, Torsten. It's a real joy for my eyes to see you both at our meeting, at our conference. So I hope that you will stay for a while with us. But now I would like to, because we're badly behind the schedule with every minute, I would like to move to the next speaker. And I will go to the Russian channel.
And now it's my pleasure to pass the microphone to Tatiana Nikolaevna, if I'm not mistaken, Tatiana Nikolaevna Vinogradova, the Chief Physician of City AIDS Center, St. Petersburg. So, Tatiana. So, dear colleagues, good afternoon, and I'm very happy to see all of you. Although it is online conference, but nonetheless, communication is always good and fruitful. I will start when I see my slides. I suppose I will repeat slightly what has already been said before me by representatives of the Health Committee of St. Petersburg government, but I will most probably change the focus of this information. Can you see your slides? Yes, I can. Just tell me when to flick. Yes, next slide, please. So, as Evgeny has already mentioned, we have approximately 60,000 people detected all over the pandemics, or just throughout the epidemics. About 16.5 thousand died, and 40% out of them died because of the HIV infections. Others have other reasons of death. Sometimes it is advanced age, sometimes it is overdose of drugs, and also some diseases which are not related directly to HIV infection. At the moment, we have approximately 46,000 people with HIV infection in the city. I would like to draw your attention to the fact that annually we detect slightly less than 3,000 new cases. This year, we detected 1,800 new cases, and 40% out of them are not permanent dwellers of St. Petersburg. That means this is our biggest challenge, so to say, because generally speaking, we have a particular number of people who should come to our center, and in the majority cases, they come from other regions of Russian Federation and abroad. So, as Evgeny has already mentioned, with the morbidity, it's not that bad as overall in Russia. There are many preventative programs, and I will talk about them a bit later. So our main situation is similar to the situation for the whole of Russia. In 13 and 14, so, in 2013, 2014, we have this crossover, and it is sexual transmission pathway that is leading at the moment. And at the moment, it is proven that usually it's just unprotected sexual contact that is the main transmission pathway. At the moment, HIV infection is beyond the risk groups and in the general population. And at the moment, these are just regular citizens or just ordinary citizens of the city that are affected. So when it comes to ART coverage, at the moment, in 72% of all the detected cases, we provide them with ART drugs. And of course, we can strive to do better, but still it is quite a good coverage already. We have suppression viral load in the majority of patients. If it is not suppressed, we actually resolve this issue. When we have a COVID breakout, we have positive and negative sides of it, of course. If you remember, at the end of March, there came publications on the internet that ART, this way or another, facilitates suppression of COVID-19 development and prevents it as well. And generally speaking, there was a situation that we expected. We thought that there will be many patients, many clients who would come actually they were afraid, as they would be afraid of lockdown, and they would actually ask ART in advance, and we actually dispense them for 3 or 4 months. So this is just normal for our center. And indeed, patients did come, the ones who wanted to get more medication, and there were also patients who came over, the ones who we did not actually see for years, because they read somewhere on the internet, because they wanted ART drugs as drugs for COVID-19. And we had huge influx of people. We had just crowds of people in our corridors. There were people who were standing out in the courtyard of our AIDS center, waiting for the drugs to be dispensed, and we don't think that it was bad. When it comes to ART drugs dispensing, first of all, we organized a registration. We also organized a hotline. We do have the hotline, but it also was used for the for booking recipes. And I know that after me there will be Maria Godlevskaya speaking, and she was actually one of the main people who developed the program, NGO, Startjeva. They provided us with their help and assistance for people with HIV, living with HIV, to provide them with ART medications. And we also organized the delivery of drugs. And our doctors were available online by phone. And if we see that the viral load is actually suppressed, and we have CD4 count increasing, they were provided with ART without a visit to the doctor. We have this delivery system up to now to pregnant women, lactating, or children with newborn, or women with newborns, advanced stage patients, disabled or low mobile people, and also people who are in isolation, on quarantine because of COVID-19, or they are in contact on COVID-19 and on self-isolation. So they enjoy this delivery system, and it's quite available for the majority of these groups. This year, taking into account the fact that many people were on lockdown, especially in spring, we actually managed to find the lost people. These are people who we know they're HIV positive, but we don't see them. And part of the social workers and NGOs, as well as the AIDS centers, they were paying visits to these people, and they brought back a number of people to the follow-up, which again is a very positive result, and it's quite effective way it was quite easy to find them because they were sitting at home this spring. And we have social billboards and social advocacy system. We have the hotline as well, and the majority of all these information billboards are they invite to come to HIV testing. We try to implement this culture of HIV testing in St. Petersburg. We actually consider that it's much better to know about HIV status and be on ART than not to know about the status and get to a hospital with severe health problems. As far as I understand, some people were on the remote mode, and generally speaking, we have even bigger number of calls to our hotline. Now you can see the number of phone calls this year. It is twofold if compared to the similar period of 2019. The number of people who came to us is, generally speaking, 8,000 higher. I suppose it's a great number. The patient school has always been organized on a regular basis, but in March it actually was transferred to the online mode. And I suppose that after the restrictions are lifted, it will remain to be online because it is on the Instagram page of AIDS Center, and it is not only for HIV positives, it's just for everybody who may have questions about HIV infection. This patient's school, they are announced beforehand, and it is online, and then you can reach any recording of it. You can ask questions online, or you can actually ask the questions in the web chat. There are a great number of visitors to this particular school, not online, but the recordings are viewed by many, many people afterwards. I suppose that this is a very effective system. Also, there is a separate school for pregnant women and HIV positives. There are gynecologists and psychologists of HIV Center. It's a similar situation with online program as well, but it's a closed one. There are more sort of narrow questions that are discussed, and there are HIV status which sometimes should not be disclosed. So the girls, in fact, they work in a, so to say, not in an open, in a closed mode. We also have a peer counseling system. I suppose that this is one of the main aspects of our work, this peer counseling. And I think that peer counselors must be very well trained. They must actually be informed and aware of any question related to HIV infection, be it diagnostics or treatment, as well as adherence, compliance to treatment, and so on. So that is why conducting just one school is not enough, but nonetheless 30 people actually came to the school, and I suppose that this is better than nothing. First rapid testing campaigns started actually quite long ago in 2010. You can see it happened on the 1st of December. Then further on we had mobile units, which are very well recognized in the city. And I suppose that our mobile units, they were not working only in April, May, and half of June. Starting from the mid-June, these mobile units resumed their activity. And next one. This is how it looks like. This is during this World Championship. Next. So this is how they work at the moment with all the necessary precautions. I mean, all the staff members, they are equipped with all the personal protection measures and means of personal protection with the thermometers inside and everything. So the mobile units are working. that provide support to the key risk groups because they continue working with them as are part of the outreach program. It's better for them to function, for these people to get any service that they actually need. I mean the target groups. Now this is prevention unit. It was not locked during the COVID-19 lockdown. We were not part of the laboratory, part of the coronavirus laboratory. We are actually deal only with hepatitis and HIV. There were no changes in this respect. The prevention unit, this is a separate premises in HIV center, in AIDS center, where anybody can come actually to exchange syringes, to ask any question, to express any hazard, any problem. If the person doesn't know, is not aware of the HIV status, then generally speaking, he will be informed and he will be provided with all the necessary consultations. We did not see huge crowds of people there, but nonetheless, if you look at the IDUs, we have certain increase, several people more, so still it's better than nothing. And these are NGOs, the main ones that work with us on HIV. We would like to express our deepest gratitude to them, because without them, I suppose our work will not be possible at all. Express testing, I would say, is done by a number of organizations. You can see that the first half of the year 2019 and the first half of 2020, we have certain reduction, but the number of positive tests is 4%. This figure remains constant. It's just 4%. We conduct an annual forum. So this year it was online, 1,700 participants from all the regions of Russia, and the great majority of NGOs also were part of this forum. On the 1st of December, we also conducted all our events. This online marathon, which we usually organize alongside with the NGOs, and we do hope that those people who were part of it received all the necessary data and information. We, in fact, continue working. Of course, there are certain nuances of this COVID-19 pandemics, but the most important thing that we try to negotiate is to have your consciousness, to have your head in place. You don't need to be too brainy actually to come to the HIV testing. You just need to understand at least something about the virus. So at the moment we have all the services available and there are no problems with that.
Oh, thank you very much, Tatiana. It has been very interesting, and esteemed participants, you're welcome to ask questions, if any. You are welcome to ask us in writing, or just to ask your question. I have a comment here. I've got it in the chat. Tatiana, you mentioned that the distribution of the ART drugs works perfectly, that you dispense the drugs, the medication for 4 months, and that a special group of people are people who are 65 plus. Do they have to come to visit your center, or there was a chance, there was an opportunity to deliver to their places? For 2012, we had that opportunity to distribute medications in different districts of the city, just to increase the commitment of the patients, to reduce their transportation costs. But now we do not have such opportunity. We have both clinic and AIDS center where we can dispense, distribute, give out the medications, but they work. They work. You mentioned that in March there was a growth of people who were eager to get ART and that they were standing in line. I remember another example of this kind before pandemic. There was a film that was released, Dudya or something, and after that people started rushing to AIDS center. What do you think? How did it affect? How did it impact the inflow of people who wanted to get tested? Are you interested in our impression of participating of being filmed? That film named Dudya, it was released at 2 o'clock. I remember in YouTube. At 3 o'clock, an hour later after the releasing, we had a queue for testing, a long one. It was the first day, on the first day. Then, since next day, since 9 o'clock in the morning, there was a queue for anonymous testing. And it was the same queue, the same line, I mean, the length up to the 8 o'clock in the evening. Usually, previously, we had to have something like 70 people a day. But after the film was released, we received something like 300 people a day. We had to involve another employer, and he joined this anonymous testing cabinet. So, and we managed with our potential. Otherwise, it would have continued for another 6 months. I mean, that eager to get tested. There was a question about coordination of the measures for prevention HIV and TB. To which extent that coordination is in place? How do you coordinate it? Yes, the risk coordination has been mentioned today. That's the people with TB, they are what we say, they are our patients. Some of them do not get ART, they are rich HIV positive. We are in connection with TB and TB service. We can't exist without each other now. Patients that get ART, that get treatment for TB as well, are they captured by screening in the HIV center for TB, for example? Yes, we have lung doctors on the staff, and vice versa. Or could people be tested for HIV in the anti-TB center? Yes, yes, sure. I hope I managed to answer. Give me a sign if you are satisfied with your answer. We are lagging behind, but the discussion is very interesting. Let us continue with our program. You mentioned Marie and Natalia and Eva. I would like to give the floor to you. Probably Maria will start. Thank you for being with us. Not that easy with the computer. Sometimes we are following different concepts with my laptop. I work in the EECA association. We work to improve the quality of life for, first of all, women who live with HIV. When the problem started, first, we wanted just to help to assist the center, the HIV center, AIDS center, in other words, to release them from part of the burden. That's what our idea. Just imagine, there are people who have problems with ART and they do not feel well because of complications. So some people decide, sometimes they do not like the medication, so they interrupt and then decide to resume again. And we wanted to help the center with just giving the patients, such patients, a chance just to approach us and to get their receipt and then to buy the drug. But there were different opinions about this initiative, and we tried to improve our skills working with first flows, just reducing burden of the professional centers. But we noticed that different types of people used to come to us. Some of them used to say, I need to go to the doctor. I had not seen my doctor for half a year. I dropped taking my drugs. And we started noticing this tendency after the beginning of the pandemic. Maybe COVID has its, we can call them this way, positive effects. Because people started thinking more about their situation. So people often ask us to deliver to the place their residency or their drugs, prescribed drugs. A part of the cities or towns were closed to prevent people from traveling, for them not to bring in, bring out COVID, and it was a problem to some extent because this such medications can't be sent by mail or whatever. So we were asked quite often to assist with the delivery of such medications to the patients. Another thing, we know that children who are born from HIV positive mothers, usually they do not get anti-TB, BCG test, and they are especially vulnerable. So we started understanding that they were another group of our attention. And some mothers were anxious that, well, I stopped taking medications, didn't see my doctor for a year now, I would like to do it, but probably they will not allow me to be registered again. We tried to help in such situations as well. Some of them wanted to resolve the problems they had, asking us to come to their places because they were afraid of going out. First, we delivered ART to those who telephoned us, and to those who were in quarantine, and to those who just asked to deliver. St. Petersburg is a very big and large cities, and there are very distant districts like Kronstadt, which is located on an island in the Finnish Gulf, in the Gulf of Finland, so territorial problems. And we used to deliver medications to retired people, to those who were with COVID and were in quarantine, and to mothers with the children. But then we realized that we would not be able to satisfy all of them, though there were announcements in all NGOs with the request to help. And but NGOs, they have their population, like drug-dependent people and so on. So their task, their focus, of course, was their population. But we tried, and we're trying to bring together our effort. We reconsidered the population we can to deliver. Now we can deliver drugs to retired people, advanced age people, to mothers with children. The problem with the elderly people is that they can't use state-of-the-art mobile phones and computers. And some of them just write warranty, legal warranty for one of our social worker. It could be a resolution, but we manage. Somehow we manage. But people get what they need, and that's great. As for the lockdowns, the towns and cities, it was topical during the first wave. And some patients telephone several for NGOs, even they telephone those who are not involved in HIV drugs distribution, and sometimes they just ask just to give them some drugs, some medications. Sometimes there was kind of dubbing, and several organizations brought them same medications. But we got experience. Sometimes we rented cars, and it was even possible at the beginning to provide testing at home. But the requirements, the needs were met. Sometimes provided additional diagnostics for mothers and for children. But it's very difficult for such a mom to ask anybody to take care sometimes of her child or children and to go to the center, to the clinic. And we did understand that the priority in such a family is a comfortable situation for the children. Testing at home. We had that chance. Now, I mean, view, but there are debates now. Some experts are not happy with them. There are a whole set of opinions, but why the situation was developing as it was developing, but as of today we can't use them. There were voices saying that there was some fakes, and counterfacts and so on. But if we do something for our patients at home, it should be high quality service. But we had that opportunity. Now, just restoring, renovating records of people, registration of those who had disappeared. There are more and more people who now start thinking that they are responsible for their relatives, for themselves, and they decide to come back to the AIDS center. There was time when such dropped out people were in the center of attention. Now people have all chances to come back and to resume their treatment. Migrants who were trapped in the Russian Federation and our women network, HIV network, organized a information campaign, and they were distributing information. Alex actually covered this topic before, and the information was spread that there was and distributed that there was chance and opportunity to get medications, ARV, and actually there were coaches who were responsible for each country. I was responsible for Russia, and someone who was trapped. Anywhere, such a migrant could go to the pharmacy and could be connected with their culture. I'm not quite sure that we have the same opportunity in future, but it did work. We were looking for other options here. What else could we do and offer a person, a trapped one, in replacement of a number of drugs, maybe? So speaking about our focus activity, actually, Madam Sukova probably will help me. The main problem was to hear what they were in need of and just to resolve their task. Natalia, you are welcome.
Thank you, Mary. You have said everything I actually wanted to say. You have saved a lot of time. I will just add up to what you have just mentioned. So when we felt in spring that our strategy is about to change, because the main task of my peer consultants that work with me for quite a long period of time, they are three. They work in St. Petersburg and the Leningrad region in the project of peer support. We had the following institutions: the Botkins Hospital, infectious department where HIV positive women deliver, and also partly women, HIV positive women from the Leningrad region. The other institution is Republican Clinical Infectious Disease in Ust-Izhora, where people from the Leningrad district or region come to be observed. I mean, pregnant women, HIV positive ones, and also another infectious hospital. All these projects stopped in spring, and we were thinking about what to do, either to close the project completely or to change it somehow, adapted to the COVID-19 conditions. So the foundation that funded this project allocated some small sum of money. It was 150,000 rubles just, but we managed to recruit the substitution of breast milk. And in St. Petersburg, the baby formula is actually provided to women because they should not lactate, they should not breastfeed. And so, thus, we continued our activity somehow. We organized delivery of all this baby formula to women. And also there was some problem actually to provide the baby formula for 2 months for babies from 0 months of life to 12 months. These women actually were not lost from follow-up because they stayed with us. We were handed over the addresses of these women and their contact data. We provided leaflets. They were provided with leaflets with our contact data. It was very important for these women not to be lost from the follow-up with their babies being just discharged from the delivery hospitals. And in summer, we were working pretty much like a hotline, like actually an intermediary between the service and the AIDS center and women. So we actually explained it to them where to give phone calls, who to contact, and actually how to work with the service of St. Petersburg. In fact, you could contact them round the clock, and there would be always a person online who would talk to women and explaining things, how to come to the AIDS center, and so on and so forth. So thus, we, generally speaking, had a very important material and support for these women. And during the COVID first wave, we had about 60 women, 34 out of them were on were just delivered baby formula. And what we actually saw when we came over to these families, we had volunteers who traveled to these women. First, we didn't have any peer consultant who were willing to travel, but we saw home violence in every third situation, in fact, and that's something that we devoted additional time to. We even developed an article and a guide for these women, how to react and who to contact in these situations. But actually, we came to their homes, we opened the doors of their homes, and we saw what was happening. There, we continued actually our cooperation with the crisis centers that are open and work in St. Petersburg. We have a very tight cooperation with the city centers of women's support and counteracting home violence. So from my viewpoint, what actually we had within this period is quite a unique event, when by means of this baby formula, we came to the families when women were very much in distress with a newborn baby, and she might have other 2, 3 babies. The majority of them are women with several kids and HIV positivity. So first of all, we came to for consultations. We also provided her with the support in ART education, and it was very important actually to provide both the financial and the moral support, and being also connected with a woman by means of any type of social media. Every woman is a unique story, unique tragedy, and a unique family background. Every second woman actually was readdressed to a psychologist. We have 3 psychologists in our staff, and they were all working with these women. And also we have We travel together with them to the AIDS center, help with the diagnostics, help with the children, and we are exactly the shoulder that supports a woman, and actually sometimes we're just the driving force and we virtually drive her to some place. And sometimes we're just the ear that listens to all the problems and understand that the AIDS center is the best place where they can get all possible support, and they should not be afraid of turning there. That's it. Thank you very much, Natalia. Thank you, Maria. Thank you for the work that you are doing currently. I don't know where you are taking your energy from in this situation. We actually are mothers as well, and that's why we do understand what to do and how to do things and what problems they encounter. I see I have a very minute question. It's very good that you actually remembered us about the swine tests, because I suppose that's something that the story is far-fetched indeed. When it comes about the sending the drugs, you actually mentioned that during the first wave it was quite topical, a very important actually thing to do. As far as I understand, at the moment it's not so important, and people do understand how to do things and what to do. People have found their own canals of finding drugs and recruiting them. Well, at the moment, we don't have the completely closed cities. Nearby we had a city or a town of Priazersk. Yes, one of the last orders actually was dispatched there. So the idea is that at the moment, we have a guy who delivers drugs there quite freely. He lives in Priazersk. He gets the drugs from the center and he goes to his Priazersk quite freely. But there was a situation when the whole town was locked down. In Moscow, for example, we had one of the orders. A person is in Moscow. He doesn't want to travel to St. Petersburg at all. And there will be, we will organize a courier to dispatch the ART medications to him to Moscow. The story is such that he doesn't want to travel in these times, and well, every prohibition, in fact, will result in a certain roundabout. And I suppose that we need the people to be adherent or committed to treatment. That's most important, because I heard, in fact, that especially in autumn, with the deficiency of drugs, I'm speaking about COVID at the moment, and antiviral drugs, anticoagulants, we have the whole movement of pharmaceutical, so to say, deliveries and shipments in Russia. People from the cities where they are, where the drugs are still in the drugstores, dispatch drugs in the cities where there is sparse or lack of drugs. So it's a huge sort of already shipment industry. Well, Maria, Natalia, thank you very much. Once again, a great many thanks. We are very happy. We have been very happy to see you, and we will stay in touch. Now, I'm not going to look at the time frames because we're way behind the schedule. Now we're going to be connected to Victoria and German from the Kaliningrad region. We can see you, but we cannot hear you. Now we can hear you as well. That's good. Victoria and German. So I'm very happy to see you. I've been missing Kaliningrad very much. So the floor is yours. Thank you very much. I just feel like, Eurovision moderator at the moment. Now, welcome to our small 1 million region, which is a little bit detached from Russia. We have 1 million people living in Kaliningrad and its region, and there are 11.5 thousand cases of COVID-19 throughout the whole pandemic time. At the moment, 6.5 live in Kaliningrad and 5.5 are on dispensary, and 4,000 are on ART, excuse me, not COVID, HIV. So why am I speaking about it? Because Kaliningrad has been known as the first region where HIV was detected, and there was a first region where it broke out as an epidemic. At the moment, the strains that we have, they require, just the situation requires much attention nonetheless. And when coronavirus occurred, all the problems became more challenging, and we shall try together with German to give you an account of these problems and how we resolve the challenges. So Kaliningrad area is first in the country where we had a merge between infection hospital and an AIDS center in one setting. Before the COVID, actually, we found it. We found no problems with that, and we just worked quite smoothly. But when COVID-19 happened, it became clear that the infection hospital is the first organization where the burden which should shoulder the burden. And HIV prevention was sort of pushed aside because all the forces were for COVID-19. So people living with HIV started getting help from the narcology setting, but it was fully designated for coronavirus as well. And all the patients, in fact, started to be directing to other hospitals with no specialized support and no specialized departments. So there was only one hospital in Chernihovsk, 100 kilometers away from Kaliningrad, with only 5 beds specialized for HIV positives. So it has become a huge barrier to our work, to our service, because many people decided to refuse hospitalization as just it is very far away. And people started distributing to unspecialized hospitals where they could not be provided with quality help and quality service. And I communicated with the head of department or chief physician of hospitals. She said that she was constantly online, constantly in touch with different hospitals, because people were keep calling her in order to ask how to treat HIV positive patients with different other problems. It has grown into a huge problem, and we even had a case of non-provision of medical service, which entailed death of a patient. There was a huge discrimination against him because he was an IDU and an HIV positive, and 4 ambulances refused to hospitalize him, to take him hospital. And he already went into a coma, and it was too late to provide any resuscitation. If he initially was taken hospital, and the doctors actually refused him, they said that there were no beds, and actually, so there was a huge scandal and a big problem. This is an example showing that the burden for healthcare system really entailed big problems, especially for such sensitive group as IDUs and HIV positives. And I'd like to say that our organization specializes for people, specializes on sex workers and IDUs. German works also with a new adult organization, Становление, and also there was a Status Plus organization, and it also was part of the social activities. That's a very important moment. And we actually were trying to deal with as many services as possible and to retain as many services as possible. The outreach had to be closed, and we started working with AIDS Center and the TB dispensary At the moment, you cannot enter it freely. So the patients actually came to the fence where we could communicate with them and provide them with consultations, I mean, social and legal advice, and also provide them with certain leaflets and information booklets. And we also opened another setting, a narcology dispensary, where one of our social workers is very active. So, just like in St. Petersburg, we also have a delivery drug system, but the Kaliningrad region is smaller in size, and only in the very stringent lockdown, there was a necessity for such delivery. At the moment, we don't have it. If comparing to St. Petersburg, we also provide all the ART for 3-4 months, but for patients with unstable adherence, we provide them with the stock for 1 month only. We continued our consultations in the office, in the online mode, and we also had a hybrid type of consultations when 2 people came to the office. And so we had people in the office and outside online, and we connected by means of internet and had communication. We also traveled to the countryside several times, twice, just to see each other outside. In summer, it was quite possible to support each other and not to be closed in any room. We just used the opportunity to go to the countryside and to do something in the lawn of nature. And we have not started the sad thing about the legal and social support, but the positive thing that on the 1st of December, we decided to open an exhibition, which was actually a present from St. Petersburg organization Astacho and the Silver Rose. It's an exhibition from people and their faces, and we just placed it in the corridor of the narcology dispensary. It's something very positive, because in such tough times, every human contact is very important. So Yulia Pisnyak actually also supported it with an interview and an article that followed. And another pride of ours, which I suppose should be mentioned, is our theater, Становление, and our new performance, which we have been staging for 2 years already, and we decided to have an online version, which turned out into a very tiring and time-consuming sort of event, but it actually turned out into a success. This is a way of touching upon a problem, talking about the problem, and talking about the friends and acquaintances, and actually to support people in overcoming different negative emotions or fears. And especially if we speak about drug users, it was very, very successful. And now German will say a couple of words about the legal and social support. I suppose this is one of the most important things that we are doing currently.
We have to discuss what is happening. And sometimes we are not able even to help, but we try to do our best. It's about the challenges that we are facing. COVID introduced changes in our life, in medical services availability and HIV area, and including diagnostics. Diagnostic services, primary examination for other infectious diseases. These are the factors that were affected, and the situation actually affected all the cascade of treatment. The laboratory, I'm talking about COVID infection, of course, effect. our laboratories started being used for COVID tests. Immune status was taking only from 15 people, and the load was measured for them, just 15 people. And you can a day, and you could imagine that we had huge lines of people, and especially difficult it was for people who live in the region, and people who covered 100 kilometers saw those queues, and sometimes they had to spend a couple of days there, and of course compliance started going down, apart from other things that were impacted. And I saw the situations when patients could not spend hours and hours in the lines, in the corridors, waiting for the doctor. And it was very difficult for women, including commercial sex workers, our target group, one of our target groups. They told me, we saw that their compliance was going down just because of their work. They could not spend days there. They had to earn money. Some of them tried to visit such laboratories at 6 o'clock in the morning, but there were queues even at that time. And now the epidemic situation is improving. We hope that the situation with the testing will start improving too. We prepared a letter even to the Ministry of Health. It's about the patients that can't be provided with diagnostics because of the mentioned reasons. So the situation with their tests started improving. They could now capture or cover something like 45, 50 patients. And the detection of virus load and the status. And it became more difficult to record and register patient properly. Some of them just were not able to wait, just preferred to leave the medical institution. But anti-drug services, they still work according to the normal schedules and plan. And in case when hospitalization was needed, people were taken to the hospital, and outpatient centers continued working properly. Social problems, another topic. During pandemic, access to work was restricted. So many people did not have money just to travel to the necessary medical center. Our NGOs were helpful, including we used to give them a lift in our own cars, and we delivered drugs, and it was easier even to get ART for such patients, at least for us. And I would like to add that people who were released, for example, for prisons, some people were released conditionally, provided that they would continue working for good behavior. It was very difficult for them. They couldn't find proper work. that could satisfy penitentiary administration. So it was conditional preliminary release from prisons, and there are our patients among them. So we described the situation and asked for presidential grants for people who were hit by COVID. So just we were thinking about testing for different diseases, for about other services for them. COVID impacted numbers of prisoners in our region, and Articles 882, you know, it was possible to release people earlier, but they started facing problems because the waiting list is very long now. I mean, for those who are HIV positive, waiting list in specialized services. It's difficult for them sometimes to see specialized medical expert. Difficult even to be hospitalized. And speaking about TB centers, even for people who, I'm talking about people who were released and all necessary taxes are paid, it's still difficult for them. So this situation is a result of coincidence of many factors, and we try not only to deliver a service, we try to provide support, and we do our best to organize everything we could do. And actually, it's difficult. The burden is great, but we are still, so to say, full of beans and quite expired by the fact that we could be useful. Thank you, Vika. Thank you, German. Just I'm in agreement with you that critical situations help us to find some inner resources, and we find extra potential in ourselves, but can't be like this forever, and shouldn't be forever like this. Thank you very much for your effort. When the COVID is over and stops traveling through cities, countries, will still have something to be proud about. I'm very grateful to you. I know that you are facing very severe lockdown in your region since the 28th of December, but I hope that it will not affect you in a negative way, neither you nor the job, the work you do, that you'll manage and will continue in winter, and the spring will come. And please stay with us if you can. We are half an hour late, just half an hour, but I think that we'll complete our day in accordance with the program, and that's why we are continuing. And I would like to pass the screen and this podium to Finland. Protocol organization area out there. The floor is yours, and I hope you'll manage to get connected.
Area okay. Area, you need to go to the control panel. Siinä on se maapallomerkki.
Okay, there is also some problem for sharing now. I have to accept that I can share. Sorry for this delay. Yes, it's there. Okay. Now it should be fine. Can you see my slide?
Yes, go into the full screen mode.
Yes. Okay. Now you can see that one. Hello, can you hear me still?
Yeah. I can. It's not actually in the full screen mode yet.
Yeah, it's here, but maybe
okay.
Maybe I have to. But what about now? Can you see my slides at all?
No. Right now, no.
Okay. Then I have to come back, start sharing again, and this would be it now. And maybe we go with this one. It's
yes,
anyway.
It's okay. Yep.
I can put it a bit bigger one now. All right, you can. It's almost a full screen now.
Yeah, perfect. Great.
Okay, and excuse me for the problems, and good afternoon for everyone. And okay, my name is Henrik Brummer-Korvekontio. I am working also in the Finnish Institute for Health and Welfare as a research manager. And I try to quickly show you some current data on HIV and STI statistics in Finland, showing the possible impact of COVID-19 epidemic on the number of reported cases. However, the data for 2020 this year is not fully completed, and there is also a small delay between detected cases and notifications recorded to the National Infectious Disease Registry. We should just keep this in mind. I'll start shortly, some background very shortly, and then go quickly through chlamydia infections and move to gonorrhea, syphilis, and finally to HIV. And you see the background now. I asked once more because to know that it's working.
Working, yep.
You see the background slide now.
Right.
Okay, fine. Then I go on. Thank you. Okay, almost 32,000 cases, COVID cases have been detected in Finland thus far, and a total of 472 patients have died. And there was a partial lockdown from mid-March to mid-June 2020, when schools, workplaces, restaurants, and so on were closed. And number of restrictions are still in place, some travel, large gatherings, etc. Only reduced healthcare services were available during lockdown. Student health services were completely closed, and low threshold health service centers were partially closed. And there has been emphasis on remote services and digital solutions, and human resources moved to COVID-19 related activities in both healthcare and laboratory services. There has been only very slightly decrease in the notified chlamydia infections during 2020. In 2020, 15,000 chlamydia infections were diagnosed, which is 5% less than last year. As in the past years, most cases were diagnosed in women and young adults. 58% were women, 79 age 15 to 29, as also in the last year. The number of gonorrhea infections decreased in 2020. Total of 464 cases of gonorrhea were reported, which is 24% less than in the previous year. The highest number of infections, 340, accounting for 73% of all cases, were reported in Helsinki and Uusimaa Hospital District, where also the highest incidence was found, being 20 out of 100,000. This year, 195 syphilis infections were diagnosed. The figure includes both reported active infections and old serological scars. The number of infections declined 23%, that means 58 cases from the year before. 64% of the cases were reported in the Helsinki and Uusimaa Hospital District, and the highest incidence was also in the Helsinki and Uusimaa Hospital District. 80% of the infections were reported in men. So far in 2020, 124 HIV infections has been notified, which is 21% less than last year. As already I told, because of the reporting delay, the final number of infections can still increase. Women accounted 25% and men 75% of those cases. And as previous years, the highest numbers of cases were reported in Helsinki and Uusimaa Hospital District. Over the last decade, roughly half of the new infections have been reported among non-Finnish origin at the time of diagnosis. In 2020, HIV cases reported among migrants slightly decreased, being 64% in 2019 and 58% in 2020. And my last slide shows notified STI cases in 2020 and the decline percent compared to the number of the last year. And as you can see, there seems to be only a very slight decline, 5% in the number of chlamydia cases. On the other hand, almost 25% decline was observed among notified gonorrhea, syphilis, and HIV cases. Except chlamydia infections, the other STI case numbers are quite low. So the possible effect of COVID-19 to the notified STI cases should be interpreted with caution. And thank you. That's all.
Thank you very much, Henrikki. Thank you for this information. So, yes, just your impression in one sentence. Do you think the situation is not that bad in Finland as it could be?
Not that bad, but it would be interesting to see next year, or at least in 2022, what's happening if we have some infections not found yet, but maybe after a year or two after the vaccinations.
Yeah, right. Yes, correct. Okay, but we will continue tomorrow after we also listen to the Norway's presentation. But thank you very much again, Henrikki. And I would like now to continue with the Finnish input, and we try again to connect to Herja. I think we found out. I still cannot.
And can you hear me?
Yes, now I can hear you very well, very well. Okay, it's really great to have you here. It's really good to see you. It's been a long time since we met last time, but I will now share the presentation, and I will go into the full screen mode. I hope you can see.
Yes, perfect. Perfect. Yes. Thank you.
Okay, the floor is yours.
Oh, thank you. And first of all, I'm sorry about these technical problems, but as we can see, we managed to cope with those. And so my name is Taina Holappa, and I'm a social worker in NGO Protukipiste in Helsinki. And my colleague Erja, she will continue right after my first few words. So shortly, I will try to put in a nutshell the information, basic information of our NGO, and then a little bit about our target group, and then something how the COVID-19 during this year has affected in our services. And then Erja will tell a little bit more specifically our notions, observations about the coronavirus effects on our target group and their lives, basically. So we are Protukipiste. We are an organization that provides services for people working in the sex or erotic industry. It's a very big concept, and basically it means that our target group includes a very wide variation of people in different kind of situations, and people who are involved or do sex work in very different ways. So in a nutshell, it can be said like there's a line. On the other head of the line, there are professional escorts and professional sex workers. And on the other head of this line, there would be victims of trafficking and people who are exploited. And between this line, there is a huge variation of all kind of situations and people. And all of those are our target group, meaning that they have a right to use our services. It also includes people like who have a survival sex, and so it's not like a profession, but it's a kind of way to survive in everyday life. And victims of trafficking, usually and specifically in the cases when there is sex work or sexual exploitation related to these situations. And our work could be described as a total of 3 levels. The highest kind of level is advocacy work, meaning that we are taking part in different kind of groups and counselings in order to trying to make a difference and influence in these decision-making processes of the social policies. And so in that way, we are trying to change maybe the malfunctions in our structure in the society, which are making, affecting negative way to our target group. And one level is that we do cooperation and consultation with other actors like public sector and other NGOs. And then the grassroots level, which is a big and very important part of our work. We have all kind of services to our target group, and now I will try to shortly tell what kind of services we have. So there you can see we have 3 basic units in Finland, in Helsinki, Tampere, and Turku cities. And there we have, in every these units, we have a drop-in service once or twice a week, and then we have online chat. Then this is the normal services that we have had before COVID-19. And then in every city, we do outreach work, both in outdoors, different kind of indoors, like striptease clubs and Thai massage parlors, and some restaurants. But internet is the biggest area nowadays where we do this outreach work. And it means that different kind of contact forums and chat forums and so on. And of course, this individual support is included all these forms of service. Then the other part of our work is community involvement activities. It means we have these different kind of groups for our target group. So there is this peer element, which is very important. There are face-to-face meetings, and then where they can discuss like something specific themes related to sex work or anything else. And then also kind of hobby and leisure activities. And Pop-Up Project is a nationwide, which is the last year this year, sorry. And it means that we have been able to go around in different cities in Finland. But how? Then during the spring, this COVID affected to our services that every form of the service which was face-to-face were totally on hold from March to June. So it means we had no drop-in group meetings or any face-to-face meetings. Outdoors and indoors outreach were totally also stopped, and also this nationwide work, we couldn't travel anywhere. But instead, during that time, we increased quite heavily our online work. We used to have twice a week chat, but now we have every day, not on the weekends. And then this telephone support service is also every weekday, and it's a longer time that we are open. Then we had this online group meetings, which is a very good thing that we had could compensate at least a little bit this peer work. Outreach work, internet, we could expand also. and communication with a new, not really new ones, but like the social media. We didn't have so active use before, but now it's getting more and more, and it's very important part of our work. The only thing that during this time we could do face-to-face in a very small amount, that we could give small these crisis packages for some people who had really difficult situation. And during this, after the summer, when this corona situation was a little bit easier, we could kind of open up a little bit and widen up our services. So we kind of started not drop-in, but the takeaway service. So it's once a week now we have in every city that people can come by and just take safe sex materials and other information. So they cannot stay here and have a chat and all that, but they can at least get something info and the materials. And face-to-face by appointment, so one by one, not many people at the time, but only one people at a time. And then we started outreach outdoors and indoors. We don't go inside, but we go to the doors and we can give information and the material from the doorsteps. One of the last thing maybe, and the quite important thing was that we're trying to reach out, especially the people in a vulnerable situation. And this STI testing, mobile testing, 3 times during this autumn, we did in street areas, and we managed to reach people that don't use our services before. And also these group meetings with the cooperation with some NGOs who work with the people of sexual minority teams, and also how to say, the teams with the multiple diversity of the gender, and refugee background and immigrant background. So we managed to give information for this group of people as well. And also we managed to do this videos, so because about using email and online services, because there are a lot of people who cannot read or write. So this is also a very, very important part. So I think I already spoke too much. So thank you for your attention, and I hope all the best in your work and in your life. And now Erja will continue. Thank you.
Good afternoon. Good afternoon, everybody. My name is Erja, and I work with Barents in Helsinki. One thing was not mentioned on the previous slide was that our testing service has been really quite busy. People can come in by making an appointment, and we are seeing more and more people who are not actually our target group, because people have difficulties accessing STI testing elsewhere. This is just a small slide on what kind of people we have been seeing and how many contacts we have had during March and December this year. 2,811 contacts with people who we have previously met, and then quite a big number, nearly a quarter of the people are new, meaning that we haven't seen them before in any type of service. We haven't looked at our statistics carefully enough in order to say exactly who these people are, but it appears that a lot of younger people are coming now, of course over 18, but I think the financial situation for many people has maybe forced some people to start sex work. And how COVID-19 has impacted the sex and erotic workers in Finland. This is all anecdotal evidence, because no statistical research has been done, but this is what we have been seeing in our client contacts, and then what we have heard also from sex worker-led organizations in Finland and in Europe. Social isolation, loneliness, mental health problems are on increase. I think for some people, sex work opportunities and income has increased, especially for those who have technical skills and can utilize the internet on marketing services. But for majority of people, there has been a radical decrease in both work opportunities and income. And the gap between different sections of our target group is getting steeper, especially undocumented migrants, trans sex workers, and people of color face more and more discrimination and violence. And the financial situation getting so bad has made people more vulnerable also. Some people have had to change their service selection to wider what they previously used to offer. Their bargaining power in regards to safer sex practices is in many cases compromised, and also their bargaining power in choosing clientele is compromised. So overall, threat of violence appears increased, and stigma related to sex work has intensified. And we have noticed that there has been a lot of problems with receiving adequate information on COVID-19 for people to keep themselves safe. This is apparent especially amongst mobile populations and immigrants who are quite confused sometimes with the changing information on how to protect yourself. And worldwide, many societies have supported businesses financially during this corona pandemic, but sex and erotic workers have mainly been excluded from this type of support. And then some people, due to travel restrictions, have got stuck in Finland, unable to return back to their home countries, or then vice versa. We think that prevention of HIV and other STIs has been compromised due to increased effort put on corona prevention. So where's the focus of Project Vista in the future? Development of innovative community involvement activities and responding to the changing trends and needs of people. We hope to increase cooperation with other services, other NGOs and public services, both nationally and internationally. We continue to advocate for human rights of sex workers and victims of trafficking. And hopefully in the future, we will develop more innovative digital and online services, because our pilot this year during the corona pandemic has proven very successful. People from different parts of Finland are able to access peer support. And further emphasis on communication and utilizing social media. And responding swiftly to the pandemic while ensuring that humanitarian and recovery assistance reaches those most vulnerable, including sex workers and victims of human trafficking, is critical. Thank you very much. Spasiba, Novum Godum, and bye-bye from Helsinki.
Thank you very much, Novum Godum. Thank you, Taina. Thank you, Ria. That was a really that was a pleasure to see you again. I really hope that you will continue. Not only I understand, of course, now the emphasis on the online communication, but I really hope that you will continue with also face-to-face meetings, with group meetings. I remember the time when I visited you with a presentation. I was talking to a group of, I think it was mostly like Russian-speaking ladies who are your clients. So I just want to wish you success, and well, it is good that you more and more are using now the communication tools. This is knowledge, and this is a skill that may prove useful in the future, not only in your job but also outside your work. So thank you very much, and I
want to say thank you for visiting us. People were really appreciative that somebody in such a high position came to see them.
Well, high position. Okay, yeah. Thank you for the compliment. And,
you're welcome.
And we will stay in touch, and both virtually and hopefully also face to face. And we will be happy to visit you again. And so, thank you. And
thank you.
Now, when the first wave of this event is coming to the end, I would like to finish this day by giving the microphone to a colleague of mine, a big friend of mine, who is sitting at a safe distance from me, but close to in the same room. So please, Dr. Ale Arsalo, we will be happy to hear your remarks, your conclusions, your impressions, please.
Thank you, my very close friend Dima. First, well, we are a little bit behind the schedule, so I will be very brief now, and tomorrow try to make a little bit longer conclusion speech. But first, thank you very much to all who have participated this meeting. It has been most interesting. And as it has been said many times in many occasions, these autumn seminars which have been organized together with the General Consulate of Finland to St. Petersburg, and especially with Consul Olli Kuukasjärvi, these have become traditional. And one finding is that from year to year, these are becoming more and more widely international. And these very clearly show, as today also, how extremely important this kind of international collaboration is. But then just a few things which I have picked up from today's presentations. First, very quickly, there have been a huge amount of different kind of studies and surveys which have focused on COVID itself and its impacts on other issues, not only other infections, but also on different kind of social issues and healthcare systems and so on. Another thing is that it seems to be very clear that this COVID pandemic, COVID situation, about which we did not know anything 1 year ago. In fact, it touches healthcare systems, it touches HIV, TB sectors, and so on. And its impacts seem to be quite interesting, one could say, in many ways. There are negative impacts, but also there are positive impacts in such a way that different kind of innovative new approaches and innovative systems and mechanisms have been developed and found. We have heard today very good practical examples from Germany, for example, from Sweden, from St. Petersburg, from Finland now, and so on. It seems that on the other hand, there have been less, for example, HIV cases than usually or before. This is probably due to several reasons. On the other hand, there have been. It is obvious that that the healthcare system's capacities have been weaker thinking about HIV, TB situations as normally, because much of the resources have been used to control this acute situation. And it may be that there are, because of that reason, just less testing than it used to be, which may mean that when this acute situation is over, then there will be, in fact, more new cases than expected. One interesting report which we heard is from St. Petersburg, the finding that there have been new clients for HIV services because of the fact that that people wanted to get diagnosed, or they wanted to get treatment as a protective measure against the possible COVID infection. And then once more, what has been very encouraging, I would say, is the quite high number of new type of innovative solutions and approaches that we have been heard and seen. And I think that this is something that we should be able to collect somehow and share even widely. And finally, especially this last point shows how very relevant and important these consulate seminars are. I will stop here now, and this was now a very brief conclusion from the first wave presentations, and tomorrow then we'll continue from this and try to make some more concrete proposals. Thank you to all presenters, and thank you, Dima. You have done extremely good work in organizing all this and handling all the whole process. Thank you, and see you tomorrow.
Thank you very much, Ali. And I suppose that it's high time we should say goodbye to each other, to all the presenters, all the audience, Zoom audience and YouTube channel audiences. I would like to thank you for the work today, and we shall resume our activity tomorrow. Our Zoom conference will be continued tomorrow, so stay connected. Thank you. Goodbye.